ऊपर का निकल स्टैंड के ऊपर है ना वो क्या बोलते हैं? नहीं नहीं वो क्या बोलते हैं? हाँ उसको निकालो, उसको निकाले वो साइड में से निकालो, इसको फिट कर वो नीचे से उसको घुमाना।
ಫುಲ್ ವೈಟ್ ಇಲ್ಲ, ಸ್ವಲ್ಪ ಆಫ್ಲೈನ್ ವೈಟ್. ಆಲ್ರೆಡಿ
Can you hear me? Can you hear me? Can you hear me?
Yes, we can hear you, Didi.
Okay. Now just testing.
Okay.
Video and audio both are working, ma'am.
Okay. Thank you, Bhaiya.
Newspaper.
Good afternoon, Excellencies, ladies and gentlemen, boys and girls. I would like to extend a very warm welcome to all of you. We appreciate you taking time off your busy schedules to join us today. We hope you will learn a lot today. We have lined up for you to be fruitful and engaging. Let's begin the program. Today, we are pleased to have the fascinating and fabulous Dr. Shivaram Varamballi, Professor, Psychiatry and Head Department of Integrative Medicine, NIMHANS, Bangalore, India. I request Dr. Patil NJ, Associate Professor and Head Department of Integrative Medicine, to introduce Dr. Shivaram Varamballi. Over to you, sir.
Good afternoon, everyone. I welcome you to the third day of International Hybrid Conference, Integrative Medicine for Humanity and Wellness. It's my proud privilege and honor to introduce today's keynote speaker, Dr. Shivaram Varamballi. Sir is an MBBS and MD in Psychiatry and also having honorary doctorate from SDUAHER Yoga University for his contribution to the field of yoga and yoga research. Presently, Sir is working as a professor of psychiatry and Sir is heading the Department of Integrative Medicine in world-renowned NIMHANS, Bangalore. Sir has been awarded to name a few of the awards. He received an award, Distinguished Speaker Oration Award at the Indo-Canadian Psychiatrists Association meeting in 2016, Dr. Vimala Veeramani Award in 2014, from the National Academy of Medical Sciences. Sir also received a Dean's Award in the year 2005 for excellence in teaching. Sir also been awarded Dr. S.S. Jairam Award in the year 2003. Sir elected member of the National Academy of Medical Sciences in 2012 and Life Fellow of the IPS in 2013 and IHSP in 2020. His recognition pioneering the work of yoga, as I said, he has been awarded honorary doctorate in yoga from SDUAHER Yoga University, one of the world's yoga leading researcher in the field of yoga and neurology and neurophysiology. Sir has been extensively done research work in the field of psychiatry and also in the field of yoga. There are more than 133 publications and 6 chapters in a book. Currently, Sir is holding a prestigious intermediate fellowship from the Welcome DBT India Alliance. He has conducted several funded projects, to name a few: CBT, DBT, CCRYN, and ICMR. With this brief introduction, I welcome Dr. Shivaram Varamballi sir for the keynote address of the day 3rd of the samanvaya 2022. Thank you. Over to you, sir.
Thank you very much, Dr. Patil, for that very generous introduction. So I'm very happy to see that this extensive conference on yoga for humanity and wellness is being conducted. I would try to give my perspective on how yoga can be a scientific addition to the approaches that we have for mental health. That is my area of work, and I'm going to try and share my slides now. Are you able to see my slides?
Yes, sir, it is visible.
Okay. So what I'm going to try and do over the next maybe 35 to 40 minutes is to try and take us through the journey that we have had in the last 15 years in terms of looking at yoga as a scientific addition to the methods that we have to improve mental health, both of normal people as well as patients with neuropsychiatric disorders. So it would cover maybe understanding of the brain system, how our brain works, and this term called as neuroplasticity, which is a very important term in the modern scientific world. Look at some evidence for yoga and neuropsychiatric disorders, and through this research, look at the possible mechanisms of yoga and illustrate it through different physiological pathways. One very important thing is this, what is called as neuroplasticity. Like I said, it's a critical term to understand, but the concept is not new. Donald Hebb, in his 1949 book, he is called the father of neuropsychology. He said neurons that fire together wire together, and neurons that are out of sync lose their link. So basically what it means is that if there is a group of neurons working together, that bond becomes stronger and stronger the more they work together. So we talk in brain area, we used to talk exclusively of brain areas. So this area for speech, that area for something else, this. But now we no longer talk of areas, we talk of circuits. So everything is a circuit. There is a circuit for epilepsy, there is a circuit for happiness, there is a circuit for laughter, there are circuits. So these circuits, the more they work together, the stronger they are. This is how we build up our skills. And critically, it is also the way to rewire our brain. That's something that we need to understand. How can we train the brain actually? Like I said, we used to understand brain in terms of areas. Now we know it is circuit. And we need to look at how, say for example, there are two basic kinds of skills and memories. One is what we call as, very strong networks, which is like, say for example, we learn how to ride a bicycle or to swim. We will almost never forget it unless we have a brain injury or something happens. This is called implicit memory. So we know it, we will never forget it. I have not swum for 10 years, you throw me into a pool, I should be able to swim or ride a cycle. Whereas remembering people's names, things, this is called episodic and semantic memory. We have to train ourselves to do it. And there are people who achieve extraordinary memory capacities by training and retraining. So this is eminently possible. And secondly, many people compare the human brain to a computer. Although they are similar in some aspects, there are huge differences. For example, till now there is no computer which can repair itself a part which is not working or change the function. We will have to do it ourselves. Whereas the brain, for example, somebody has a stroke in one area of the brain. Over time, the brain learns to give that function to another part of the brain so that the function goes on. Otherwise, nobody with a stroke would ever recover, isn't it? So this ability, the computer does not have. Maybe the computers of 100 years later would have. But as of now, the brain in many ways is superior to a computer. Do we know, most of us will be aware that most of the neurons in the brain are already present by the age of 6 to 7 years. But there is very interesting recent research that says that development of new neurons does not stop at that age. It can go on, of course, not everywhere, but in certain areas of the brain, particularly in the olfactory bulb, in the area called as the hippocampus. You can see it in this CT scan. It is labeled in blue. So that part is very critical for memory. And here neurogenesis, new neurons can be generated till the age of 65 and 70 also. This is a very important thing to know. How do we do this? How do we make sure that we are generating new neurons, we are remembering things, we get better? I explained to you about implicit and explicit memory. For explicit memory, the only thing is practice makes perfect. One example is what is called as the 10,000 hour rule in pilots. So pilots are considered to be expert if they have done 10,000 flying hours in a particular aeroplane or a system. Why is that? It is considered that after that point of time, this memory becomes so ingrained that it is almost automatic. So you wake him up in a crisis, he wakes up at 12 o'clock in the night, he should be able to land the aeroplane safely. So this is something that we have to understand. Now we come to what are the ways that we have found to train the brain. There are many ways. Yoga, fortunately for us, is one of the best ways to train the brain. Of course, please note when I say yoga, I always include meditation. Yoga without meditation is like physics without mathematics. It cannot happen. So any yoga has to be meditative and mindful. Otherwise, I wouldn't really define it as yoga. Much of the yoga done in gyms and studios does not really have this mindfulness aspect, and therefore it just becomes physical exercise. Some of the other ways, intermittent fasting has been shown to improve neurogenesis, having new experiences, learning a new skill, involved reading. When I say involved, I mean forgetting yourself. So there is a very nice book if you want to read, a book called Flow. This is a book written by a very famous psychologist, Mihai, who is a very famous psychologist, one of the pioneers of the positive psychology movement, who was a Hungarian who emigrated to America and has written this book called Flow. In that, he actually says the flow state, achieving a flow state where you are forgetting yourself in what you are doing, is one of the important things for attaining happiness and joy. And he goes on to say in his book that yoga is the most systematic method of achieving the flow state. So that's something you get involved in a book or a activity so much that you forget yourself. There, that leads to improved neurogenesis. Now, I think for this audience, going into the details of what is yoga, I'm not going into, but I would like to emphasize one fact that if you look at all the traditional texts of yoga, most of them talk only about training the mind, not really the body. Training the body is a step on the way to training the mind. And of course, you need a fit body to be able to make full use of the mind. But other than that, the body is only a short-term goal on the way to training the mind. So all this talk, you can look at Yoga Vasishtha, you can look at the Gita, you can look at Patanjali. All of them talk about controlling the emotions and the mind. If you look at the Niman's logo in this slide very closely, Professor Govinda Swami, who was the first director of Niman's, was a noted psychiatrist and also a noted Sanskrit scholar. So he has put this in the logo of Niman's when it was started in 1954 itself. Look at that. It says Samatvam Yoga Uchyate, which comes from this Bhagavad Gita, which talks about Yogastha Kuru Karmani Sangam Tyaktva Dhananjaya. So give up attachment, do things in a yogic manner. Siddhi asiddhiyo samo bhutva. Forget the difference. You have to be able to treat both success and failure in the same way. And Rudyard Kipling in his famous poem, If, much later, said the same thing about meeting triumph and disaster in the same way. So this is what has been really defined as yoga. People who look at yoga in the lens of the physical exercise miss this point. Now, of course, Patanjali was the first person to put yoga into a systematic kind of a method. Not that yoga was not there before him, but he systematized it and put it into a understandable form. And he, of course, laid out the eightfold path of yoga, of which most of the times we focus only on asana and pranayama. We miss the forest for the trees. So the first 5 here, Yama, Niyama, Asana, Pranayama, Pratyahara, are considered to be a part of what is called Bahiranga Yoga, which is the external yoga. Some people say Pratyahara bridges between Bahiranga Yoga and Antaranga Yoga. But the last 3, Dharana, Dhyana and Samadhi, are clearly internal or Antaranga Yoga. These are not necessarily steps, but these are the aspects that we have to look after if we have to reach the yogic ultimate. We have, in fact, published a paper a few years back looking at comparing yoga and physical exercises. Although they may look similar from the outside, there are very important differences, and many of the physiological changes are actually the opposite between yoga and physical exercise. So this is a very interesting thing. So to put it very simply, attention to the breathing and mindfulness define yoga. And these are usually not the case in exercise. So if you do yoga without mindfulness, without attention to breathing, it would be equivalent to physical exercise. This is a slide many of you might have seen if you have listened to me before. I put it in all my presentations just to show the, that what you do is maybe important, but how you do it is equally or if maybe more important. Of course, all of you will know the person in the top half of the slide is Iyengar Guruji. Of course, I don't know the person in the bottom half, but the effects of these two, although they look the same, are likely to be exactly opposite the next morning. So this is just a slide that I put in the middle of my presentation. So what have we been doing at Nimans? We have been looking at yoga as a research tool, of course, almost 50 years now. It was mainly non-clinical research. In the 1990s, we started working with the Art of Living Foundation to look at yoga as a tool in depression. And of course, since 2000, we have been collaborating with the SDUAHER Yoga University. In 2007, for the first time, we set up clinical services for yoga in Nimans. That was an advanced center in collaboration with the Morarji Desai National Institute of Yoga in New Delhi. And in 2014, looking at the results of these 5-6 years of work, Nimans established the Integrated Center for Yoga as a part of the institute itself. And I'm happy to say that in 2019, we were able to integrate Ayurveda and yoga along with modern medicine and make it a department of integrative medicine. So this is the journey at Nimans. What have we been doing in the yoga space? We have been trying to develop some kind of a generic yoga modules, fairly simple yoga modules, which can be taught by any reasonably trained yoga therapist for different disorders. Because the moment you say yoga, it can mean anything from a simple Surya Namaskar to a complex dhyana. And this, we have to be specific what yoga can help in what conditions. So we have developed, validated, published modules for all the disorders that you can see highlighted on bold here. The low backache, migraine and multiple sclerosis work is going on now, and we will hopefully shortly publish this. Of course, I did not tell this audience about the benefits of yoga and healthy, but to summarize, a lot of things have been shown to improve mild depression, anxiety, quality of life improves, psychological test performance, memory, non-memory tests, stress hormone, cortisol comes down, oxidative stress has been shown to come down, and there have been indirect measures such as improved evoked potentials in the EEG and actually increased gray matter in the MRI, people who meditate and do yoga for a long period of time. This is a study that we did in elderly people in and around Bangalore. These are not patients. These are people who have very slight memory problems. So like our grandmother, grandfather, okay, I cannot remember the person's name. I left my spectacles somewhere. This kind of issues. We went to the old age home. Dr. Hari Prasad did his PhD, taught them yoga for 6 months, took a control group who stayed in the same place, ate the same food, but did not do yoga. And we found very clear changes in memory at the end of 6 months. I will talk about the other neurobiological thing later. Let's first look at mental disorders, depression, which is the commonest psychiatric disorder worldwide. This is a review by Kramer in 2013. As you can see here, most of the studies show that yoga was a fairly good treatment for depression. Mind you, most of the studies, except a few, were all add-on studies. They were not yoga alone, but still they showed a significant benefit of adding yoga. This is one of the first studies to use yoga as a treatment alone in psychiatric disorders done at Nimans using Sudarshan Kriya Yoga from the Art of Living Foundation, comparing 3 arms. All were patients with major depressive disorder, looking at yoga alone, ECT, electroconvulsive therapy, and imipramine. And what we found was that ECT, of course, was the best, but imipramine versus yoga, there was no significant difference. Both produced almost equal kind of effect. This was the first trial anywhere in the world done by Dr. Janaki Ramaya and Dr. Gangadhar at Demands. First trial to show that yoga could be a treatment by itself. Then we have looked at another recent study done by Naveen as a PhD a few years back. Again, we took 3 arms. This was non-randomized. We allowed patients to choose only medication, yoga plus medication, yoga only. And as you can see, all these produced a similar kind of improvement. So yoga was as good as medication in this study. Now let us look at the other big problem that psychiatrists treat, which is schizophrenia. This was the first study done by Ganeshan Duraiswamy, MD thesis under Dr. Gangadhar, where we added yoga as a treatment in schizophrenia, and we found significant benefits in negative syndrome. We repeated this study and we published it in 2012 with a bigger group and a control group. So there are 3 groups: yoga, exercise, waitlist group, and we were able to show again that particularly negative symptoms of schizophrenia, which is very difficult to treat with medication. We have excellent medications for what we call as the positive symptoms. So positive symptoms are delusions, hallucinations, aggressive behavior. So that we have very good medicines. The negative symptoms are amotivation, elogia, not wanting to do anything. For that, we do not have great treatments in modern psychiatry. Yoga was able to actually produce significant improvement in negative symptoms as well as actual social functioning. So these 2 studies together have been quoted in the National Institute for Health and Care Excellence, the famous NICE guidelines of the UK, which has actually added yoga as a complementary treatment for schizophrenia in the NICE guidelines in 2014. So, of course, as you know, people abroad pick up these things very fast and act on it. India has still not added it in our own guidelines. This is another recent study done by my colleague Naren Rao along with SCARF Chennai, again confirming that yoga has a very strong effect on negative symptoms of schizophrenia. Another important element in patients with schizophrenia is what we call as social cognition. Empathy and social cognition are very critical to life. Social cognition basically means ability to recognize other people's emotions and mental state by looking at their face and interpreting what they do. And this is a big problem for patients with schizophrenia. And we were able to show that this so-called facial emotion recognition deficits improves with yoga. So if you look at psychiatric disorders as a group, how effective is yoga as a complementary treatment? The effect size is indeed very remarkable. So if you add yoga as a complementary treatment across any psychiatric disorder, you are likely to get much more benefits than other treatments alone. But interesting part is, how do these things happen? What is the neuroscience behind these effects? For that, we first have to look at how do we generally learn yoga, whether it is me or you or a patient. We learn yoga from a teacher. We imitate the teacher. We then perform with mindfulness, then synchronize the breath, and then aim to be relaxed except maintaining the posture, and then focus on the experience. After this asana part, we add the pranayama. So in this process, what you can imagine, of course, is that we need to be able to imitate and use our brain to be mindful. This is very important. Of course, this is something I'm not going to focus on. These are metabolic changes with yoga, which have been shown, which are very important in medical conditions like diabetes, hypertension. Also important for patients with psychiatric disorders who have multiple comorbidities. But as I said, very interestingly, we found that in patients with depression, not only the depressive symptoms came down, cortisol went down significantly in people who did yoga. And this showed a very, very nice correlation between depression coming down and cortisol coming down. Another big marker of neuroplasticity, the process we call neuroplasticity. What is neuroplasticity? Is basically the ability of the brain to change or repair itself. That is what we call neuroplasticity. And this brain-derived neurotropic factor, BDNF, is one of the best markers of this process. We were able to show in the study by Naveen et al. That regular yoga practices increases serum BDNF. It is a well-known fact that BDNF is decreased in patients with depression. And if you look at what happened before and after treatment with yoga, you can see here that the BDNF levels were low and got better after treatment. Regular practice, the word regular here is very important. Of course, just like medicine, yoga also needs to be done very regularly. Mind you, it is not only yoga which increases BDNF. Most antidepressant treatments also work in the same way. So ultimately, the final common pathway may be neuroplasticity. Again, a very, very nice correlation between cortisol going down and BDNF going up. So to put it very simply, it looks like a system like yoga, practicing yoga allows the brain to go back to its role of repairing or changing itself, which when people are depressed, they cannot do that. Yoga brings it back to the state where allostatic load is not very high, and therefore the brain is able to resume its normal activity of neuroplasticity. That's what it looks like. Very interestingly, this was a recent study by one of my students, Aditi, who finished her PhD. How does this BDNF increase happen? What we found is that the pathway for mature BDNF is through something called as pro-BDNF. Pro-BDNF is converted into mature BDNF. Pro-BDNF actually is dangerous for the brain. It is a pro-apoptotic, and therefore increased levels of pro-BDNF are harmful. And in depression, it seems like this conversion from pro-BDNF to BDNF is affected. After yoga, this process becomes more efficient. So this is a very interesting finding that we have done recently. On the other hand, in schizophrenia, there is a hormone which we call as the bonding hormone or the love hormone, which we call oxytocin. So this oxytocin is very much connected to social cognition, and we were able to show in a study in schizophrenia that after yoga, oxytocin levels increased. It also, this is again recent evidence from my Y-scan study, where we were able to show that with yoga, gene expression of oxytocin also increased. So this is a downstream mechanism. You also have, of course, neurophysiological mechanisms. What yoga can do, you know, the stress response pathway, and yoga actually modulates the autonomic nervous system, decreases the sympathetic overactivity, and brings back balance by increasing parasympathetic nervous activity, mainly through the vagus nerve. It also works on the hypothalamo-pituitary axis, cortisol and GR receptor signaling. Direct effects on the brain, threat-related regions, which are hyper-aroused in patients with depression and anxiety disorders. Yoga can calm those areas and improve sensitivity of the reward-related regions. These are all based on evidence for yoga studies in healthy and depressed people. Now let us look at some of the other lines of evidence. This is a P300 cognitive event potential in the EEG done in patients doing art of living, that Sudarshan Kriya Yoga. Actually, it showed improved amplitude of P300. GABA, gamma-aminobutyric acid, which is the most important inhibitory neurotransmitter in the brain, is known to be decreased in patients with depression and anxiety. So why is GABA important? When the brain has to control something or inhibit something which is not needed, GABA is very, very important. And therefore, if it is not happening, you have continuous worries, thoughts. That thought process cannot be stopped by the brain because GABA is not doing its job. And here Streeter showed that after a single session, there was an increase in GABA levels in the yoga practitioners group. And then she did a follow-up study. Chris Streeter looked at a follow-up study using magnetic resonance spectroscopy. Yoga, she showed that it changes GABA levels, which did not happen in a comparison like walking. This is the first time that a behavioral intervention like yoga was shown to be associated with an acute increase in GABA levels in the brain. This was a resonance spectroscopy, so you can directly look at the chemistry of the brain. We have looked at it in another way because MRI is very difficult to do. This is something called as transcranial magnetic stimulation. It's a method of applying a very small stimulation to the brain from the outside and looking at what happens to the electromyograph, EMG. So when you give a TMS pulse, there is something called as a cortical silent period, which is through GABA. So there is inhibition by the GABA, and as you can see, the EMG sort of goes down. This should happen normally whenever a stimulus is given, and we were able to show that after the practice of yoga, the cortical silent period, which means the inhibitory capacity, improved quite dramatically. We did it in healthy individuals before and after 20 sessions. And this is an example of one person, healthy person, where the cortical silent period, which means the inhibitory capacity, almost doubled after 20 or 1 month of yoga practice, 20 sessions. What about in patients with depression? We were again able to show that this works in depression as well. As you can see this slide, people with depression had very low CSP. Walking did not change it very much. Yoga increased the cortical silent period, although it did not reach the normal. The orange bar on the rightmost side is normal healthy individuals. As you can see, the direction is towards healthy, but of course, this was only after 5 sessions. Maybe if we had measured it after 50 sessions, it would have come back to the healthy level. Another very interesting set of neurons is called as mirror neurons. Professor Rizzolati's Nobel Prize winning work very nicely showed that there is a group of neurons in our brain which react when we see somebody else doing something. We need not do that. If I see somebody drinking coffee, some neurons in my brain light up. I may not need to drink the coffee. This is very important for learning. Now that's what I want to bring you back to the point I was talking about. How do we learn yoga? So mirror neuron activity is known to be very low in, say, for example, patients with schizophrenia. Oxytocin also is low in schizophrenia. And there is a very nice association between deficits in mirror neuron activity and poor social cognition. As I already showed you, the oxytocin is increased after yoga in patients with schizophrenia, and we have also shown through studies that mirror neuron activity also can increase. I will show you, maybe I will show you in some other slide because it takes quite a lot of explaining. But we have been able to show using something called as functional near infrared spectroscopy. It's a method which can look at the brain non-invasively. You need not go into an MRI machine. We have been able to show that mirror neuron activity increased. And like I said, when we do yoga, we imitate somebody, our mirror neurons get activated. Let me talk about some neuroimaging studies using MRI. It is now fairly well demonstrated that people who do yoga and meditation over the long term, their brains remain well for much longer than people who do not. When I say well, what do I mean? The gray area of the brain in all of us reduces with age. Anybody can see a brain of a 20-year-old in a scan and a 70-year-old, even a layperson can make out the difference because of the atrophy. Whereas people who do long-term yoga meditation, this does not seem to happen so drastically. This is a recent study looking at elderly women who have been meditating for a long period of time. And as you can see, the cortical thickness is better in people who are doing long-term yoga practitioners. This is a very simple study done at NIMHANS by Dr. Kalyani, which showed that a simple Om chanting can actually produce change in the blood flow to areas in the brain such as the limbic system, which control our negative emotions. So this is just a simple thing. What happened to the blood flow in the brain when Om was being chanted, and we were able to show that the limbic area, which is the area that controls most of our negative emotions, anger, greed, lust, that area received less blood flow and therefore became calmer. This is very interesting. Elderly people, as I told in Hari Prasad study, we were able to demonstrate a small increase in the size of the hippocampus after 6 months of yoga practice. This is remarkable because it means that all of us, no matter what age we are, have the potential to improve our brain functioning as well as possibly brain structure by the practice of yoga and other similar practices. I'm coming to the end of my presentation. I want to leave you with some recent work that we have done. There is something called as the default mode network. Whenever we are not doing something, we are relaxing, our brain goes into something called a default mode. And that network is known to be poor. Connectivity is poor in patients with chronic schizophrenia. And when we did yoga, when the patients did yoga, the coherence between these, the connectivity actually improved. If you look at the before and after here, the yellow indicates coherence and connectivity. As you can see, before and after, yoga was able to change the coherence of this default mode network. So putting all this together, you can possibly hypothesize how yoga works in depression. So there is reduction in cortisol, increase in neuroplasticity, which BDNF is a marker, improvement cognitive event potentials, improved cortical modulation, which is GABA mediated, which leads to improvement in physical and mental symptoms, improvement in cognition, reduced stress and risk of relapse. Similarly, you can put it all together in schizophrenia and see what are the important points here. Mirror neuron system, oxytocin, both together improve social cognition and possibly lead to better outcome and reduce negative symptoms. So to summarize, I would say that some of the findings I have already spoken to you about. We have not only looked at symptom improvement, but also the possible biological correlate. Because this is very important to be seen as scientific evidence, you have to be able to explain how something happens, not only what happens. So this is something that we have been doing, and of course we need to do a lot more in other psychiatric disorders. So the key learning points to take away, we know that yoga practices have very positive effects on brain health, and they have shown efficacy as adjuvant treatment in psychiatric disorders and recently even as treatments by itself, depression and schizophrenia. And the likely mechanisms include the hypothalamo-pituitary axis or the autonomic system, neurohormones, neurotransmitters, gene expression changes, mirror neurons, and brain networks. Of course, there are challenges in this area of research, but tremendous potential is there. This could be one of the areas in this century, and I hope many of you get into yoga research and make more discoveries in this area. So, of course, I would like to acknowledge all our collaborators, the Art of Living, the SVASA, Yoga University, MDNY, Ministry of Ayush, and of course, Professor Gangadhar, who was the pioneer in this team at NIMHANS, Dr. Venkat, who does most of the neuroimaging research, and of course, the team at the NIMHANS Integrated Center for Yoga and the collaborating departments. Thank you. I hope it has been useful.
Thank you, sir.
Yeah, I'm trying to stop sharing.
The chat box, I will read it for you.
Yeah, I'm not able to actually. I can. Okay.
Sir,
Yeah.
how effective will be tele-yoga? Because I think, NIMHANS came up with the tele-yoga guidelines during COVID. Compared to the, physical or maybe in-person yoga or maybe how effective will be? What's your thought on it?
A very good question, because how effectively you can teach yoga depends on a lot of factors. One of the things, of course, is that correction is very difficult in tele yoga. If somebody is doing yoga practice, if you are physically in front of somebody, you can go and correct it. But in tele yoga, it's a little bit difficult. So we are trying to do some research on this. At this point of time, I would say that if you're looking at yoga as a stress reduction, yes, tele yoga, of course, can do wonderful. But if you are looking at yoga as a therapy in patients with psychiatric and neurological illness, I'm not so sure. I think we have to do a lot more research. Till then, I think physical sessions are better for such. But as a general stress relief for patients with mild anxiety, I think tele yoga is a wonderful tool. I think you are muted, Dr. Patil. Yeah.
Hello. Yeah, sir, what is the scope of certificate course in integrative medicine? Maybe recently NIMANS has started.
Yes.
Because ours is a medical college, one of our students is already attending there.
Oh, okay.
Maybe other few people are here, maybe they are interested to know that.
So basically, this course, what we want to do is not really to teach the basics of yoga. I don't think our idea is that. The idea is to broaden the concept of integrative medicine. I believe that actually all medicine is integrative. If you look at the family physician 50 years back, there are no specialists. The family physician managed almost everything by themselves. And they would give advice on diet, they would give advice on many things. We have to go back to that model. We have to, whether I am an allopathic physician, I am an Ayurvedic physician, or a naturopathic physician, I have to be able to tell people. A person in India cannot afford to go to 4 or 5 specialists for a single problem. It is simply not possible. So the idea is to train professionals from various streams to be able to at least give basic concepts of each of system of medicine so that the patient benefits. That's what we're trying to do.
So another question from the audience here, that is related to the how long for the structural or maybe neurochemical or neurotransmitter changes needed to know what kind, how long, and what is the duration of a session, and how long, how many months or years bring that changes what we are now talking about.
So yeah, it's a good question, but the answer is not so simple. What we have actually found in our research is at least 3 days a week of yoga is necessary to produce changes and maintain those changes. What we have found is that some of the changes can happen very fast. Gene expression changes can happen within a few sessions. Cortical silent period can increase within a few sessions, but for structural or other major changes, it would take anywhere between 3 to 6 months. And after that, a regular module of at least 3 days a week, if you can do, it will maintain those changes or lead to further improvement. Less than that, we have found does not work. There is some evidence to show that a single yoga session, the effects last for around 6 days and then go away. So it has to ultimately become something like a lifestyle if you have to maintain the benefits.
So if you have time, another 2 questions are there.
You should have time. I have time, but you should have time.
Yeah. So this is regarding the endorphin release after yoga. How long person has to laugh? It is a very funny question, but very interesting also. How long session should be, and how people need to how many sessions it required to bring in so-called happy hormones, what we talk about.
Endorphins, of course, there is some recent research by Dr. Hemant Bhargav, who is my colleague at NIMANS, looking at opioid dependent people. So how to increase natural endorphin levels so that they don't need the opioids. What he has found essentially again is that the session need not be more than 40 or 45 minutes. You can produce changes, but how regular is it is the question. If you do it 5 days a week, very likely that you will have significant benefits within 2 weeks. We have most of our patients don't stay for longer than 2-3 weeks in the ward. But by the end of 3 weeks, they are able to reduce their opioid medications quite significantly. So you can produce those changes, but the problematic part is maintaining it. You know that all of us, if we are asked to take medicine for 6 months, most of us will stop it by 2-3 months. Similarly, yoga also is like that. So once the person gets into the habit of doing yoga every day, in a sense that we shift the addiction from opioid to yoga. If you can do that, yes, you can be successful.
So last question, sir, for the day, for this session. Sir, what are the, maybe in a medical education, maybe it is little, maybe because demands, they may be, very interested. NMC related, what are the challenges or how really need to integrate in a medical education related thing?
So this is a very tricky and a difficult area. But what I would say is that yoga is reasonably easy to integrate. Now, Ayurveda is a complete medical system in itself. So there are many differences between allopathy and Ayurveda. But yoga, I don't think anybody would have any major objections, because it is something that most medical professionals can pick up an understanding of. It does not need a very big setup. It does not need a lot of infrastructure. So yoga can very easily be integrated. I think the NMC has already started in this direction by introducing yoga Ayush systems as an optional course for people who are in allopathic medical colleges. What I believe is that ultimately all medical colleges, whether they are allopathy, Ayurveda, whatever it is, should have a unit or a department of yoga. And the faculty in that department should be from that stream. So if it's an Ayurveda medical college, it should be an MD Ayurveda who has additional yoga or a Swasthavitta qualification, who should be the faculty. In the allopathy, it should be somebody say like me, I have done MD psychiatry or MD medicine, I have some additional qualification in yoga, I should be the faculty in allopathic college. That is the only way which will take yoga and Ayush forward. I think that is something we need to start doing.
Thank you, sir, for your sharing your knowledge and thoughts and research done in NIMHANS and also other part of the world, and also addressing the questions and giving some kind of ray of hope, integration and the what ways way ahead. We thank you so much for your session, sir, for enlightening about the research related to the yoga, sir. Thank you.
Thank you, Dr. Patil. Thank you, SDU. Thank you very much.
Thank you, sir.
All the best.
It was an enriching speech. There was a precise illumination regarding training the brain, generic yoga modules, mechanisms, how yoga works, etc. Sir also elucidated that yoga is effective through strong evidences. Please accept our thanks for a great explanation. Thank you, sir. Now, let us all be inspired with the wisdom to be given by our spectacular and magnificent speaker, Dr. Prashant Gupta, Associate Professor, Department of Kaumarhritya, All India Institute of Ayurveda, New Delhi, India. I invite Dr. Patil NJ, Associate Professor and Head, Department of Integrative Medicine, Sri Devaraja's Academy of Higher Education and Research, to introduce Dr. Prashant Gupta. Over to you, sir.
Namaste, Prashant ji. Namaskar. Dr. Prashant Gupta, as an Ayurveda graduate, did MD and PhD in yoga, and he is a fellow in traditional medicine and integrative health, which we jointly we have together attended in Savitribai Phule University, Pune. Prashant sir is actually a very dynamic researcher, having multiple projects from the central or most state government research projects. In a short span of after, I think, his fellowship from traditional medicine and integrative health, he has, I think, in the last 2 years, more than 35 publication in international and national peer-reviewed journals. His research area is Swarnaprashan and Ayur Informatics. He is presently guiding so many MDs in the Ayurveda field. He is also a national secretary for the Arogya Bharati wing of RSS, the healthcare wing. This is no lot of things to say, but I think I will give more time to Prashant Gupta ji. He's working at present in All India Institute of Ayurveda, a very prestigious institute of its kind. In New Delhi, he's an associate professor there. Without taking much time, I will invite Prashant Gupta ji for his talk. Thank you. Please.
Thank you, sir. Thank you, Dr. Nitin ji. I'm blessed to be your friend and your colleague, and we have done multiple projects and publications with you. So I'm very fortunate to have a yoga fellow like you in my team. So we have multiple maybe talks, but I choose that Swarnaprashana because many times it happens that when we talk about immunity and daily morbidities and the research related with Swarnaprashana, many of the fellows are not knowing what actually is going on in that Swarnaprashana. I'm audible now? I'm audible?
Yes, it is audible, sir.
Sure. Thank you very much. So my introduction has been already been given, so I'll start directly from my talk. So maybe 50% of the audience would be from the Ayurveda background. So Lehana or Lekables is just an unique concept given by our just a minute. So it's a unique concept given by Indian ancient classics. It is something like semi-solids continuous containing ghee, madhu, or some local leakables in that particular formulation, and having some herbs, and which makes this lehana to be easily palatable, leakable. And starting with some basics, it was started maybe in Kashyap Samhita. There is a direct reference citing that there should be a lehana, and in that we find Swarna is also Swarna Prashana is also. The purpose is just to supplement the nutrition, so we can use that Swarna Prashana in malnutrition, enhance immunity, maybe equipoising the immunity, not enhancing, maybe modulating the immunity. So we can go for the common morbidities, developmental and physical growth, and convenient methods of administration. Yes, it is a convenient method of administration of medicine in the child. Many times we add some add-on herbs which can simultaneously work on the ailment the baby is suffering from. So is one of the type of the lehan which where we find Swarna Bhasma, honey and ghee, that is buttermilk, and herbs for a desired benefit. So I think screen is
visible, sir.
Visible. So starting with I have taken some of the references. Starting with Kashyap Samhita, you can find there is a Swarna, Ghat, and honey. While the indication is everyone knowing that it's Medha, Agni, Balvardhanam, Mangalam, Punyam, Varnyam. So here you can find that Swarna is given, but the type or mode of Swarna is not given. Whether it is a powder, whether it is a bhasma, whether it is foil, it's not been given. And this after almost 600 years, should also given 4 types of classical preparations, naming Kanchana, Kanaka, Hema, and some other medicines. Maybe that time that may be Medha, Balvardhanam, that Matsyakshi, Shankapushpi, Arkapushpi, Kaidarre, and Shvetadurva. They were the add-on herbs which were basically used with Swarna. So just after 400 years, then the Ashtanga says a Swarna, that Hema Raja. Here he says there should be a Hema Churna. And the Vacha, again the indication is almost same. And the 7th century, again, the Swan, Ghrut, honey, Shvetavacha, Matsyakshi, Shankapushpi, Arkapushpi, Kaidarya, and Shvetadurva. So bunch of, or a cocktail of herbs being used to trigger the Medha. Medha means intellect, and Bala, that the musculatures. So again, after almost 600 years, Sharangdar again quoted for the Swan Bhasma, Ghrut, and honey, given at birth also. So again, some more references like Rasratna Samuchya, then Bhava Prakash, and then Yog Ratnakar. Surprisingly, in 14th century, first time that Pipali is been also added for in Swan Bhasma, or that Swan Prashana. And what we call that nootropic medicines, that Brahmi, it's only appeared in that Swarnaprashan in 18th century. Before than that, not even a single author has substantiated that Brahmi to be included in Swarnaprashan. Nowadays, what we are finding, that every Swarnaprashan or any preparation like Swarnaprashana is having maybe nootropic like that Brahmi or Centaurea asiatica or other nootropic medicines. Yes, there is a query, or there is a question mark over the general dosing of the Swarnaprashan. Right till date, we do not have any concrete research over what should be the dose of the Swarnaprashan, but taking the reference of API of India, that Swarna Bhasma is to be used in 15 to 62.5 mg, and then using the body surface area or some normal areas of calculating the dose in the pediatrics, we calculate the dose of Swarnaprashan right now. But although we are working on it, maybe in next 2-3 years, we may be in a situation that what would be the optimum dose of Swarnaprashana in maybe for Medyata, for immunity, for Chakshwata. So we are searching some dose specific Swarnaprashanas for simple or segregated or isolated this ailments. So we are going to discuss now the publications related to the Swarnaprashan. What we find when I was collecting such data, what I find that Swarnaprashan is being used with much names like Swarnabindu Prashana, Swarna Amrita Prashana. In South India, we find other different names. In North India, we find different names. And yes, for gold form, most of the fellow are using bhasmas, and other herbs for sure honey and ghrut been added, and the dose is starting from 0.1 to 4 mg or up to the 8 mg of gold been used till date in the publications, maybe in the research. And yes, the healthy childrens are being used, maybe ailments are also used. Many fellows have used it daily. Some fellows have used it in Pushya Nakshatra for 6 months, maybe 12 months. And what we find in common results of these research were that eating habits has been improved, the appetite has improved, weight and height has been improved. Maybe that has triggered the physiology of that baby, but in almost all cases, what we have seen, the appetite improvement and the common morbidity reduction. Taking some other research, maybe Swarnamrit Prashana, here also bhasma has been used, but here you can see a cocktail of herbs has been added in that Swarna Prashana. And yes, we can have an add-on effect of Vacha, Jata, Mansi, Ashwanda, Shankushpe, Yashti, Madhu in reducing the complaints of cough, bronchitis, tonsillitis. This research is also is I think a substantiated research. In another research, what we find that the child with recurrent respiratory and GIT ailments were chosen, and 1 mg of gold bhasma up to 5 years, and above than that, was the fixed dose was given, and no herb was added, and it was given for continuously for 30 days, empty stomach. And what we find that nasal discharges was reduced and loss of appetite was improved. Again, in another research, what we find, it was given in a Pushya Nakshatra, and 1 mg per kg was was the criteria for selection of the dose. So maybe if the baby was 10 kg baby, then 10 mg may have been used, and they showed only a significant weight increase, and no other parameter was improved in that paper. So we can further go, and what we find that this is the only paper where we find a newborn being the subject of that Swarnaprashana. In 0 to 3 days, we have taken that subject age, and daily once for a day for 6 weeks, that 0.7 mg fixed dose was given. Calculating the Swarnabhasma dose, it was given with no other herbs. So episodes of illness, infrequent means that regurgitation of the milk and the hunger cry was improved, or maybe more hunger cry was there because of the fire was more, appetite fire was more in those cases. And here the safety was also evaluated, and renal and liver toxic function test was done, and it was normal in, or maybe called as physiological, within the physiological limit. This is the study where I should salute the IEC also, because getting IEC and CTI approval for such study is very, very tough. Sonamrita Prashan, yes, again the bhasma was given, and the cocktail of herbs, 4 drops of Sonamrit, 2 mg gold per dose was used, and again for 9 months Pushya Nakshatra mein it was given, and some common morbidity was improved. Swarna, again one more publication, improvement in height and weight and chest circumference. And again improvement in Dhi Smriti. It was an observational, it was no that studies maybe called as maybe further improved. So 2 more studies were there where again a preterm was the subject, preterm less than 37 week, and within the age of 3 years, this intervention was given. Again, getting IC is likely to be impossible in current situation. So daily on the basis Pushya Nakshatra for 6 months, those patients were treated, and the recurrence of that diseases were reduced. Yes, the only study I find on the internet not using the Bhasma was the last, this in the frame what you can see there. You can see a pure gold of 3 circles for weight by volume was used, and the children up to 5 years were the subjects. Again, Pushya Nakshatra was the target day, and that no toxicity or adverse was seen, and the common morbidity was reduced. Yes, what we did in last year, we did a research. We searched almost all Swarnaprashana available online, and we calculated the dose pattern, the cost pattern. Surprisingly, Swarnaprashana on the internet is available from 100 ml, 100 rupees per 5 ml to almost 645 rupees per 5 ml. Such a disparity in Swarnaprashana and markets. What we can find that only four Swarnaprashana has given what is the concentration of gold in their content in their formulation. So this is a matter of policy that once we are getting the Swarnaprashana in the market, we must reflect at least the gold on the leaflet or maybe on that box, on the packing. So we can find that the Swarnaprashana having 180 rupees per 5 ml had that Swarnabhasma 0.2%, and the best was 15 mg per 5 ml in 416 rupees. If we calculate the dose, or in fact, if we calculate this through the dose of the cost of the Bhasma, what we can find that in such a low cost, we cannot create a good Swarnaprashana. 50,000 per 10 grams the gold, and then if we are making it Bhasmi Bhutam, then it will almost 50% of the weight is been lost, and the process itself is a long. So counting it maybe this is next to impossible if somebody is giving 0.2% of Swarna Prashana in 5 ml in 180 rupees. So in last 2-3 years we have done some basic research regarding Swarna Prashana, and we have taken 4 samples. What Shushruta has told us that Swarna Bhasma, Ghrita and honey was a sample 1, sample B was Swarna Bhasma, Ghrita, honey and Acorus calamus. Sample C was that Swarna Bhasma, Ghrita, honey and herbs. Herbs may be different herbs, we will discuss. And the 4th one, which Kashyap has told us, that gold foil, Ghrita and honey. We have not taken that wire, we have taken the foils. To the surprise of the extent, the most antioxidant property was in the sample A. Only Swarna Bhasma, Ghrita and honey. You can see. So simply getting Ghrita, honey and Swarna Bhasma is equally, in fact, more effective in sense of antioxidant properties. While we are not knowing whether these cocktail of herbs can been potentiating the effect, but at least for antioxidant property, these herbs are not going much. Yes, physicochemical characterizations of all those 4 samples we did. All the major thing is the pH was constant in all. So FTIR, yes, we can see the absorption peaks. Sample A, B, C, and D. Sample A had only Ghrita and honey, so less absorption peaks, while sample B and C had good herbs, so absorption peaks were much in sample B and C. So we can, yes, there would be hydroalcoholic extracts of convolvulus pluricoris and other Acorus calamus was in sample A, and B was also treated with some herbs given on the reference of the Shushruta. So we can see that after in the final product we have phytoconstituents, but as of now what they are doing, we are much little knowing about them. So adding herb would definitely add the therapeutic value of that Swarna Bhasma, but not in the sense of antioxidants. Yes, yes, electron microscopy is also being reflected. What we can see in sample A, you can find Ghrita, honey and Swarna Bhasma. So one thing is clear, that the structure in A2, you can find the structure is spheroid. Yes, okay, it's palatable. In the B, you can find that again the spheroid in nature, but some phytoconstituent or some hydroalcoholic extract is encapsulating that elemental gold. In sample C, yes, again some herbs are encapsulating that element, and sample D, where the foil was used, you can see the aggregates of the gold. Means the absorption must be maybe less in sample D, where we have used a foil. So it's better to use Bhasma now rather a foil. And in the structure 4 SAD pattern, you can find that this is a crystalline structure. It's for sure all 4 have a crystalline structure. So it's good to have it time studies of Swarna Bhasma, Swarna Prashana. Yes, many times people say that your medicines may have heavy metals and all and this and that. So we went through the ICP-AES, which is an inductively coupled plasma atomic emission spectroscopy, where we find what are the elemental contents and what are their stages. So in sample A, where we use only Swarna Bhasma, we find iron, maybe due to that Kharala, it may have entered, or maybe due to the ore, which ore we have used for the Swarna Bhasma. So copper was not detected in that. Many a times lead and arsenic was also called. Surprisingly, not even a single sample was having AS arsenic in our sample. Yes, the highest gold availability was in sample B. Means the elemental content was highest in sample B, while sample C, where we have used that Matsyakshi and Shankpushpi, the elemental gold means it may have been a phytoconstituent linked gold, which will not be counted in the ICP AES. Hence, the phytoconstituent and elemental axis would be more in sample C. Sample D, again a foil and an aggregate. So silicon may have been came from surprisingly that sample D had only the silicon, and lead was in the permissible limit. Although it was present, but it was in a permissible limit. Yes, a very important and interesting study we did. Maybe not much fixed in this presentation, but what we have done many a times, we've been called that our drugs, maybe our bhasma, are the carriers, maybe a nano carrier or a drug delivery vehicle. So what we did, we loaded a rifampicin, a known anti-tubercular drug, over our sonprajna, sonbhasma, and initially we did it in the gold nanoparticle, and we stabilized that yes, gold nanoparticle can carry that rifampicin and isoniazide. Then we replace that gold nanoparticle with gold bhasma. So gold bhasma, you can visualize here on the screen that gold nanoparticle has less carrying capacity than gold bhasma. This is for sure. But this was just unloading. We were also worried about what would be the fate of unloading, whether it will remain intact, the drug will remain intact with the bhasma or not. So we did further studies, and what we find that you can find in gold nanoparticle there is a burst, almost like a burst absorbance is beyond 1, even in the first instance, maybe in a control also, and in first 3 hours itself absorbance was 2. Simply means that there was a burst release whenever a conducive pH is coming to a gold nanoparticle release that medicine. While in our cases, in gold bhasma particle, there is a smooth release of the medicine. Rifampicin and isoniazide both were released, and to the surprise, 18% was loading in gold nanoparticle, while 32% was loaded on gold bhasma. Again, the release pattern is also very good in gold bhasma than compared to that gold nanoparticle. And in the last picture, you can visualize that gold nanoparticle has a cumulative drug release percentage which is reaching to 80%, maybe called 42% in first 5 hours, while our gold bhasma released that drug very much in a sustained release pattern. You can visualize the upward slope in green line, while there was a burst release in that red lines. Again, there was a concept, there was a word in fact in a Sharira, there is a word called Matsyaksha, and in a bracket itself in the literature it is given Brahmi. What we did, we collected the Matsyakshi, and then we authenticated it through Delhi ICAR, and then we did HPTLC of Matsyakshi and the Brahmi. To a surprise of extent, both are totally different. Although one alkaloid is common, which you can see at 0.4 to 0.5, that peak is almost common. That peak 4 in track 5 and track 2 may you can visualize the peak 8. So they are the common, maybe otherwise nothing was common. So replacing Brahmi with Matsyakshi is not good. If somebody is using Matsyakshi, it is better because it's almost given in all literature. So what are the still where we are lacking, or what we have to achieve? That modern approach of sonography dose calculation is not researched. SOP, yes, yet to be made. self life, yes, again, duration day, Pushya Nakshatra, where somebody says Pushya Nakshatra is best to be given or administered, while somebody says every day it is better. So these need to be researched. Yes, physicochemical characterization, we are trying, maybe in next 6 months or 4 months, we may get a very good publication over the kinetics and dynamics of the Swan Prashana. ADME study we are doing, yes, almost done, but yes, again, it's a cell line ADME. We may be having better ADME studies with animals. Yes, very the next one, there is a high inter-individual variation in method preparation. Yes, somebody is preparing the aqueous extracts of these herbs and then adding, somebody is adding the raw powder of those herbs, somebody is using maybe foil, somebody is using that bhasma, and someone is making some grata, that Ashtamangala Grata has been added in Swan Basma, and then the honey is added and it is called in Swan Prashana. So inter-individual variation is very high. Although the AFI also do not say anything about Swan Prashana, so we can do of our choice. Yes, practices are also very different. Somebody is using as a nootropic, somebody is using for immunity, somebody is using for weight gain or something. So we need to have a concrete policy on it. Maybe some better institutions also working on it. So Jodhpur is also working on Swan Prashana, and recently I heard that they are planning they are developing an SOP for uses and making of that Swan Prashana. Development of standard assessment criteria is still not there. If somebody want to research over Swan Prashana or the clinical trial over Swan Prashana, we do not have standard assessment criteria till date. Very limited safety profile studies been still published. We have only 4 or 5 publications on safety profiles of the Swan Prashana. Yes, what we can think of how we should look and what are the future prospects of Swan Prashana. A public health initiative, yes, it is a better option for Swan Prashana because it is a generalized medication, no expertise is required, and can be used in healthy individuals. So public health initiative for Swan Prashana at any, I have heard of, yes, I worked for Chhattisgarh government, and there I submitted a proposal. Eventually it got accepted, and now they are running the Swan Prashana in all Ayurved gram. In fact, at all, maybe in near future, we may get the sanctions for setting up the Swan Prashana OPDs in each and every PSC of where that Ayurveda fellow is being posted. So this is a very good public health initiative from Chhattisgarh Sarkar, state government of Chhattisgarh. Yes, we can plan, we can think of standalone for Swan Prashana, which we are using now, and along with the immunization, we are doing a sincere research or a clinical trial where we are using Swan Prashana in integration with the immunization, just to check the takeoff of the vaccine, where the primary and secondary failure of the vaccine, and maybe in next year we may have that data with us, that if we are adding Swan Prashana with standard immunization to the baby, what are the changes or what are the positive or negative changes that baby have. Disease specific interventions, some fellows are using that for cerebral palsy, ASDs, and mild to moderate IQ deficient patients are also being treated by Swan Prashana, and very enthusiastic results are also been visualized. So adjuvant capacity, yes, if we are giving some specific medicine, we can add Swan Prashana. Maybe if we are giving that Shitapaladi, we can add it with Swan Bhasma to add on effect. Yes, what research potential we saw in that Swan Bhasma, Swan Prashana. Many times fellows come to us and they ask how to do research in Swan Prashana. So we generally reply like, we can work on it's been given in the Shastra that it is an Varna. Varnata is being calculated or been researched through melanogenesis pathways, desquamation, pigmentations, melanin transfer mechanisms. So how our Swan Prashana is working in that way. Maybe in Chakshusha, yes, prematurity disorders like ROP, retinal repair, ROS, vision corrections. Yes, we have listened the stories that my baby was taking that Sonprashana, and now the specs removed, or the vision is improved, or the glare of the face is improved. So these, if it's not research, it's just a story. Yes, T1, TH1, TH2, immunomodulation, phagocytic activities. These are the areas where the Sonprashana can be researched. Again, ACHE activities, NDMA activities, BDNF activities can be utilized. Rather, just before my presentation, the sir from that Gangadharan sir's institution, he was also saying that that mirror neurons and all, we can also incorporate that in Sonprashana, because anything which has an nootropic activity or nootropic assessment, we can incorporate in that Sonprashana research. So as of now, I have that much of knowledge with me, so I just shared that Sonprashana research, and I welcome any query or suggestion if anybody has. I acknowledge Professor Nitin sir and his team.
Hello.
Oh, I have done early?
Yeah, Prashanti, excellent, informative and insightful talk. There are a few questions in the chat box, but most of the things have been addressed. So I have another question. Maybe what is the government initiation in this regard already? You have any idea? You already told in the future this thing. A few of these states I heard they have started regarding Swarnabindu Prashana administration in the government hospital, either the dispensaries. What is that present status? Can you able to give any overview about that?
Okay, sir. As of now, what I know, that it was initially given in Udupi. It was started from Karnataka, and Professor Shailja Madam has initiated, and it was like public health initiative. Almost 20,000 footfall was there in those days. Right now, I'm not knowing what is the status of the footfall, but then other states also adopted. In Uttar Pradesh Sarkar, Uttar Pradesh government, they are also running a collaborative project with Dabara, and in state government of Chhattisgarh, they are not taking any grant from anyone. It's a state grant, and it's almost setting up a Sonprashana as an PHI, and a research work is also been granted in that maybe a 20 lakhs project. So central government is also very interested to encourage that Sonprashana for PHI, for research. Right now, as of now, no center of excellence for Sonprashana is there in the India, but maybe in next 1 or 2 months, you would be having information that there is a COE also in a prestige institution.
There is one question I will take from a chat box, because even I still feel that need to be addressed. What are the brand you recommend? Because you have said a lot of issues related with standardization, a lot of things SOP need to be done. So nothing is in dosage and how many days. There are not clarity. What are the as in your personal experience? What are the brands or kind of Doodh Papeshwar kind of thing? Because what you recommend the brands?
So my recommendation is generalized. Don't go with any product. You just make it. I have told in my presentation that adding herbs is not so fruitful. So just having a ghat, just having a honey, which is available in all of the homes of the India, and having a bhasma. So procure a best bhasma, maybe the company which you said, Doodh Papeshwar or Kottakal or that IMPCL, whosoever is making, it's a good bhasma. So just add it according to your need. If your baby is 20 kg, go for at least having 2 mg in the 10 drops. So it is very easy to calculate. If you are a doctor, make your own Sonprashana. I would not recommend even a single Sonprashana available in the market, because because you can find 140 and 642. So 140 per 5 ml and 642 per 5 ml. So if somebody asks me that what should be, if nothing is available, then go for that Papeshwar's 1 Mahaswan Yog 1 mg tablet or 2 mg tablet, and then calculate it according to the weight of the baby. So there is a question: what is the safety of Swarnaprashan available in markets?
Most of the questions you have addressed. Still, you can able to share more thoughts, because these are all very sensitive areas where Karnataka has started some amount of this thing. We don't have no negative thoughts about the Swarnaprashana, but the quality control is something very something, because of the kids and the kind of nephrotoxicity and hepatotoxicity is an issue. This will be the last question, I think. So next session is there.
So
please.
I would like to add something. So share your experience about ADR of Swarnaprashana. So we have a patient of Bruton disorders. Means there is it's a primary autoimmune disorder, maybe it's an deficiency disorder where we do not find any immunoglobulins in the body. It was diagnosed last year. Since last almost 14 months, the patient started our OPD in November, and then we started only Swarnaprashan and Guduchi Ghansat. Not more than this. In last 7 months, he had only 2 episodes of fever, and that 2 recovered with the antibiotics. I'm not extrapolating anything. I'm not saying that it is due to the Swarnaprashana, but maybe after 6 months, because that immunological profile we have done, and we have calculated the CD counts and all that immunological markers, they were not firmly improved, but the clinical status of the baby has firmly improved. It got 3 kgs weight gain in last 6 months. Maybe a confounding factor, during last 6 months he is not attending the school, but again, now from July 1 the schools are going to open. We will evaluate that baby on the October last month, and we'll report it in the publication. Standard dosing is yes. I request 0.1 mg to 0.2 mg is the standard dose per kg, and if you find it is difficult to get accurate dose, use a fixed dose of 1 to 2 mg of Swarn Bhasma, not that Swarn Prashana.
Okay.
Best brands you recommend for Swarn Prashana? Sorry, excellent session. Okay, namaste.
Thank you.
Thank you, sir.
Thank you for your insightful and informative talk. Thank you.
Thank you, sir.
I request Dr. Nodus to take over.
Thank you, sir, for throwing some light on Swarnaprashan with research evidences. We are always amazed at your ability of presentations. Thank you very much.
Thank you.
Ladies and gentlemen, it's my distinct privilege to welcome the assertive and benevolent Dr. K.J. Malagi, Professor, Department of Integrative Medicine, Sri Devaraj Arts Academy of Higher Education and Research. I request Dr. Dhanashri Patil, Assistant Professor, Department of Integrative Medicine, Sri Devaraj Arts Academy of Higher Education and Research, to give an introduction about Dr. K.J. Malagi. Over to you, ma'am.
I'm glad to introduce Dr. K.J. Malagi. Sir is MD in Ayurveda, and presently Sir is working as professor in the Department of Integrative Medicine, Sri Devaraja's Academy of Higher Education and Research. He worked as a professor and head in the Division of Ayurveda, Center for the Integrative Medicine and Research, Mahi, Manipal. He served the Mahi for more than 3 decades. Sir has been invited as visiting professor at Thames Valley University, London, and as a Panchakarma specialist in Germany. His expertise in the field of wellness, stress management, and preventive measurements in lifestyle disorders. He presented more than 20 papers in the national and international conferences. Sir chaired the sessions in the several conferences. He delivered more than 35 talks in the national and international conferences. Sir authored a book. The name of the book, Successful Ayurvedic Approaches to Obesity. Sir has been awarded with Jivak Ayurveda Vishwa Sanmana, Panchakarma Ratna, and Ayurveda Bhushana. Sir specialization in the field of Panchakarma and wellness. With this brief introduction, I welcome you, sir. Over to you, sir.
So good afternoon, everybody. Thank you for inviting me here to share my thoughts. The topic today is wellness application in healthcare management, which is the need of the hour. So the way to the wellness, Dr. Nitin Patil has already created the way to the wellness, and the theme also, it is there. So the way to the wellness is started at Devaraja's University in the Department of Integrative Medicine. The main aim of us is Sarve Santu Niramaya. No doubt, it is a bad sight for the doctors, but being an Ayurveda man, I say that everybody should be happy and healthy, which is the way of the wellness. And even our Veda also says the same thing, Sarve Santu Niramaya. So what is the wellness? First of all, we have to understand what I am, and that is the self-care. Nowadays, we are coming across so many lifestyle disorders. It means that we have not understood ourselves. If we can understand ourselves and follow the path which has been followed since ages in India, then probably the lifestyle disorders, the concept would not have been there. And to start with, Ayurveda is one of the ancient system of medicine which has been said, time tested clinically by our forefathers, Charaka, Sushruta, Vagbhata, and all. So the concept, what it says is why we should choose Ayurveda, because it says it starts with not only with the food itself, even the lifestyle also, it usually says, because the main aim of Ayurveda is the person should not be feeling sick. Swasthasya swastha rakshanam. How a swastha is defined, it is one of the beautiful concepts which has been said in Ayurveda is samadosha samagnishta samadhatu malakriya prasanna atma indriya manaha. All of you know, but the concept of prasanna atma indriya manaha, I usually want to highlight in the concept of the wellness here is well-contented body, mind, and the soul. If we ask ourselves, is anybody in the world is healthy? Probably the answer is no. Because none of us are contented. None of us are contented because contentment play a vital role here. Even our Prime Minister has, in the Ayush department itself, they have started the wellness centers everywhere. Even Devaraja's University is planning to start the wellness center. So this applies to the body, mind, and the soul itself. So here, what you are supposed to do is maintaining the balancing the body, mind, and the soul. Is it possible every day if somebody has to take care before going to bed what I have done, the good things and the bad things, if you can analyze those things and if you can remember the good things and forget about the bad things and correcting the bad things, then definitely you can prosper in your life with the inculcating the yogic exercises, especially the meditation. That is what in the beginning itself I have said, swastasya swastarakshanam. Then comes the aturasya vikara prashamanam. It means that Ayurveda gives second preference to treating the diseases. Definitely that has to be. Now it is the way to the wellness. So your body is like a temple. Can you take care of your body? How I can take care of my body? The beautiful quote has been said in Ayurveda, Nityam hita ahara vihara sevi samikshakari visheshu asaktaha data samaha satyavan kshamavan aptopasevi cha bhavat arogaha. A person, one who takes, one which is wholesome to his body, not in general. Because Ayurveda believes in the concept of the constitution. It can be Vata, Pitta, Kapha, or the combinations and all. Depending upon that, that person has to take the food which is conducive to his body and samikshakari, whatever which is good and bad to himself and to the society, if he can inculcate and then Vishayeshu asaktaha, maximum things, can we leave off whatever which is not good for the body and even to the mind also. And my mentor, Dr. B.M. Hegde, the former vice chancellor of our university, has told me there are only two words in the world, that is take and give. A person, everybody is interested in taking itself. Once, if you start enjoying the giving, tata samaha. If a person starts giving, then you can start enjoying in the world. So when he has told me, when I started that particular concept in my life, then I have left even expecting the thanks from anybody. So that gives you mental peace. So data samaha, satyaparaha, which is a very difficult this one. Kshamavan, can you forget and forgive everybody? Aptopasevi, because your forefathers have already set an example. Just look at the second and third generation earlier. Maximum diseases were less in the families. Now, each and every family person is suffering from the things. So, aptopasevi bhavat arogaha. Then it is, you can become a nirogi or without any diseases. So our game plan, the first and the foremost thing is the formula for the wellness against the illness. So wellness, when you see that particular individual, the complexion point of view, or even the positive aura on that particular individual itself, there you can make it out. Yes, this is a way of the wellness. Definitely, you can see the illness. But now what is happening? How I am rich? That is only for the humor sake, not for any other things, because I am rich, silver in the hair, probably you can see in my hair itself, and gold in the teeth. Some of people might be having crystals in the kidney, sugar in the blood, lead in the ass, iron in the arteries, and the inexhaustible supply of natural gas. I never thought I had to accumulate such type of wealth in the body. So what is the thing is, illness is a message from your body. Listen carefully so that you can see. This is the history, what we can see, evolution. It is from the ages itself. It has been said long back itself, we can follow the wellness concept. Nowadays, people are becoming aware of it. Why? Is because rather than the disease care, health care play a vital role. I can quote so many examples here. We can bring down the economy if we can establish the wellness centers everywhere, so that we can bring down the healthcare costs. So if you see the scale here, definitely the wellness will be on the rise. So David Frawley, one who has studied Ayurveda, yoga, and the astrology also, practicing in America. And what he says is 90%, 95% of what we think, say, and do as an adult comes from our unconscious behavior as a child. I don't blame the child there. As a parent, if I am inculcating some of the things in my child, definitely when he or she becomes adult, they will follow the same thing. So the wellness point of view, you can choose to subsidize your illness or invest in wellness. Choice is yours. This is the creativity of an artist. If you can just think it over, you just see there a poor man and a rich man. Rich man has got an abdomen that is, especially in the female, definitely after the delivery, it may go, but in the male, it will be EPND, that is ever pregnant, never deliver. So our ancestor, the founder or the father of the medicine, Charaka, what he suggests is promote righteous all around and cultivating certain qualities, that is truthfulness, compassion, spirit of generosity, calmness, self-control, controlling the one's desires and all, that play a vital role in the wellness. So what is self-care? Put happy things to each and every day. Can you spread the happiness and compliment the people? If somebody has done, it might be your junior itself. Can you say, well done, keep it up? Can you say, is it possible? Your own child might have said, or your senior might have said, is it possible? Start complimenting each other. Notice the beauty around you, nature. But nowadays, even for going for a walk also, I will be having the headphones and chatting with my phone itself. I will be going for a walk also. I don't know whether I will have a dash with somebody. Build confidence and health by exercising and eating clean. So these are the things which a person can go ahead. Happiness is a state of mind, and we have unlimited access. We are not getting it, just like our internet differences. So these are some of the things which I have already said: giving, relaxing, exercising, all these things a person can start. If a person is very interested in taking the tablet itself, let them have this tablet, which is the patience and the self-belief, so that he can be happy and healthy. So wellness is awaiting you. Your journey to the wellness begins here. We, as the Indians, we believe in Vasudhaiva Kutumbakam. It means that we are not interested only the Indians should be hale and healthy. We want the whole world to be hale and healthy. Somebody may ask me a question: if everybody becomes healthy, how can we have the marketing things and how? If somebody sees this, particularly the business people, if they can see that, definitely we have got a big market things, $490 billion. This is because I was teaching the marketing and business methodologies in the Manipal University for my students and all. My students are practicing everywhere in the world. So they have told me that, sir, wellness can be practiced very easily rather than the illness. So the spider makes a web from itself. Man creates problems from his own mind or the desires. Relieving from the desires is a supreme. So probably the Buddha, he has the only person, he has said that desire is the root cause of the disease. All of us, we have got the desires. If we can leave that, then definitely we can achieve. It means that people have what they have understood nowadays. Everybody, whenever yoga says, as one of your earlier speakers and all, they have said that yoga means the exercises and all. Sorry, it is the controlling the mind and the body. This one, because the definition of the yoga, what it says, chale chittam chale vatam nischalam cha chale bhave. Yoga is the only concept which makes the mind control. It is the only thing which can control your mind and the breath also. So what is the difference between health and the wellness? It is a state of complete physical, as all of you know, WHO standards, nearly the absence of disease, injury and all. Wellness, an active process of becoming aware and making choices towards the healthy and fulfilling the life. So can I fulfill the things and can I help others also, not only myself? Positive component of the health, sense of well-being, and the product is multi-dimensional. So these are the aspects of the wellness. What is the difference if somebody asks, making the things, factors that contribute to the disease? All of you know these things, unhealthy lifestyles or the poor environmental quality, inadequate healthcare, and the hereditary concepts are also there. But if you see the health promoting choices, healthy lifestyle, if I can inculcate healthy lifestyle in my way of approaches and all, definitely we can improve our healthness. So we have to trust in our family health, and we inspire the people to be healthy. He who has the health has hope, and he who has the hope has everything. This is a beautiful concept told by in the Charaka Samhita, that is the Achara Rasayana. It means that the way of life, once how you are supposed to lead a happy life. Rasayana, it is anti-aging also. If somebody follows these simple principles itself, it can help in anti-aging also. That is a pure life, honoring life, and positive and balanced life, and compassionate and peaceful life. So healthier lifestyle is not merely health, spiritual, mental, fundamental basis, so that you can improve your fitness, handle probably the most critical issues on everyday's existence. Tadeva yuktam bhaishajyam yad arogyaya kalpate sachaiva bhaishajyam sreshto rogebhyo yah pramurchate. So that is the Charaka's quotation. That is the right medicine which makes for health. If you can give that medicine so that the health is reverted back, a person will get back, and he is the best physician who relieves the people from the disease. One of my teachers, he used to say that a good physician is, he should know when to give the medicine and when to stop the medicine. That plays a vital role. So we are helping all to remove the rust and the dust so that the gold will shine. As Ayurveda practitioner, we are not the healers, but we are the directors for the self-awareness. So the secret of the health for both mind and body is not mourn of the past, not to worry about the future or not to anticipate troubles, but to live the present moment vividly. So, can we acquire a good habit? If yes, then definitely life is good. Make it beautiful so that you can help. So, please join us in the path of the wellness. Yeah, Ayurveda believes in family health, and it is a top priority, and we are ready to take it. If you can take action today itself, then your dreams can become the reality. If that happens, then your smile becomes your logo. Your personality is your business card. How you leave others feeling after the interaction becomes your trademark. So that I need not have to give my visiting card to anybody. Just my feeling, meeting us itself, it can show that how well we are. If any questions are there, it is open. You can ask me.
So what is the global perspective of wellness?
It is coming up in the Western countries and all. Definitely, the people are aware, because when I was teaching to my US students and all, at that time, the students, they were asking me how to follow this daily regimens, seasonal regimens and all. The US students, they were asking me. So I was amazed that how these people are more aware. Even while practicing in Germany also, at that time, people were asking me all these things, how we should not become sick. That awareness has come. Now it is up to us what we can deliver the things in. So that is why I usually used to tell to my students that you are the brand ambassadors. You can do that things much easily. Yeah.
So this is so what is the way ahead to incorporate the Ayurveda component into the integrative medicine? Where to begin? Yoga is more of non-invasive. Acceptance is very easy. How to begin an integration in Ayurveda to the allopathy conventions?
Okay. Okay. There probably the diet concept play a vital role. Advising the diet itself and the lifestyle. Diet and the lifestyle that can be incorporated initial stages. Later on, we can go for the invasive medicines. Those things can be taken up at a later stage. Lifestyle advice. You can do that because, as I have told you, Rachar Rasayana, definitely that can be incorporated. You can make those things and actually advising according to the constitutions and all. It is tailor-made diets and all we can do. It is possible according to the individual system. It can, and nowadays you can give online things and all according to the constitutions and all, assessing the constitution and helping them not to become the sick. What they are supposed to take, that can be done.
What are the last question? What are the area of research in the domain of wellness you recommend?
I say the protection point of view, it is the diabetes and the obesity. Because genes play a vital role. Say, for example, as a parent, if I'm diabetic, I have to take care of my child. So, as a clinician, if you can help the next generation people, the future is there. So, then you can advise from the beginning itself so that you can help the society.
Thank you, sir, for the informative and insightful talk. Hope it has enlightened our participants online and offline. Over to Nuzar.
So we are blessed to hear from great personalities like you. It was an insightful and delightful presentation. Thank you, sir. Thank you for expounding the ways to attain wellness. Once again, I thank you. Now, I request Dr. Patil NJ to hand over a memento to Dr. KJ Malaki as a token of appreciation. Thank you, sir. Now, we feel honored to have with us the substantial and substantive Dr. Kashinath Samagandi, Associate Professor, National Institute of Ayurveda, Jaipur, India. I invite Dr. Ashwin Bilagi, Assistant Professor, Department of Integrative Medicine, Sri Devarajas Academy of Higher Education and Research, to give an introduction about Dr. Kashinath before his talk. Over to you, sir.
Thank you, Nuzar. It's a privilege to introduce Dr. Kashinath Samkonde. He holds qualifications bachelor degree in BMS from Bellary, Karnataka, MD in Swastarata and Yoga from Hassan. He's completed his PhD, and he also has a diploma degrees in nutrition and health education and yoga and naturopathy. His areas of specializations includes Ayurveda dietetic, iron modulation, Ayurveda way of life, Ayur lifestyle, yoga and personality development, and yoga therapy. He has visited many places and delivered lectures all around the world. To name few, World Health Assembly of WHO in 2018, Geneva, Switzerland, Beijing, China on 4th International Day of Yoga in 2018. He has also visited many other places, Kunming, Vietnam, Switzerland, to name a few. His publications includes 4 books and 4 monograms, 35 international and national peer-reviewed journals, 6 magazines, and 17 newspapers. He's also a reviewer for many renowned journals. He has awards. He was the first in Karnataka MD Common Entrance Test in Swastarata and Yoga. He also has a Yoga Parangata Dhanvantri Award and Best Paper Award for his oral presentation in 2015. With this brief introduction, now I call upon Dr. Kashinath Samkonde, Associate Professor, NIA Jaipur, to deliver his lecture. Thank you.
Thank you. Am I audible? Am I audible, organizer?
Yes, it is audible.
Audible, sir.
Greetings to all of you. Yat jagrutam duram udeti duram tato suktasya tatayveti durangamam jyotisham jyotirmadde shiva tanmaya sankalpamastu. The topic which I am going to discuss today is yoga for humanity. As we all know that every year on 21st June, we are going to celebrate International Day of Yoga, and every year Ministry of Ayush come up with a theme, particular theme, on the basis of the health situations, on the basis of social requirement, on the basis of global need. They will come up with a certain theme. As we all know that in 2017, there was a amendment of National Health Policy 2017, and main goal of National Health Policy was that attain the universal health. So to parallel that goal, even Ministry of Ayush projected the theme of Yoga for Universal Health. In the same way, as we all know that so in the year 2019-20, total globe was totally in the grip of coronavirus. At that time, so people were, ministry thought that if the person are active, ultimately they can maintain their immunity. That is the reason they come up with the theme of yoga at home and with family. In the same way, in the year, in present year, there is a theme of yoga for humanity. So purpose of proposing this theme is that, as I stated, since 2 to 3 years, every person they saw what is the impact of the coronavirus pandemic, and even because of this nature of humanity. So now, even though now globe was affected by coronavirus, but we are not to such a high extent we affected because of this humanity nature shown by each and every person in combating the coronavirus. It may be in the form of like giving the food, it may be in the form of providing the shelters, or it may be in the form of providing the free medications, and even COVID warriors. So doctors, nurses, and even NGOs are also involved, and they extended their humanitarian act. Because of that, we were able to combat this huge pandemic. So that is that may be the one of the reason why Ayush Ministry proposed the theme of Yoga for Humanity for 2022. So here, these are some of the research study which says that ultimately the humanity are extending the nature of humanity will helps to combat lots of pandemic diseases. Here, just you may see that in first line of this research article, who wants to be a doctor when an epidemic or a pandemic occurs? Ultimately, we all know that many people, especially when there was an outbreak of pandemic, especially during the time of second outbreak, at the time even doctors are also scared, and many doctors they took leave, and they were they were confined to their house. They were very scared about themselves. But there are other people who came forward, and who came forward and served all the public, especially it may be the police, it may be traffic police, or it may be any army, or it may be any NGOs. They came forward, they didn't bothered about their health, they didn't bothered about their life, but they extended their humanitarian. So ultimately, so here what exactly the people they want need is that humanitarian, so our humanity attitude. So again, this is also one of the research article where it says that humanities and social science have must to control to beat the pandemic. So whenever there is a pandemic like situation, not only medical science, even each and every person should have the attitude of serving the society. When each and every person will be having, then only we can achieve the universal and global health. So if it is so, then what is humanity? So it's a special, you can consider it as a special attribute of all the humans. So in simple way, if I want to say what is humanity, humanity is a nature of nurturing all. It is a character of caring every person, or it is an attribute of adoring or admiring everyone. In simple way, it is like extending the unconditional and selfless service to the each and every person, wherever he is, whoever he may be, or whenever he needed. So extending the selfless service to the community is considered as the humanity. And one thing, humanity is the special character only found in the humans, because there is a beautiful verse in Upanishads. They says that ahara nidram bhayam maitunam samanya metat naranam pashubhi. That is ahara, nidra, bhaya, and maituna. These are the four factors which are common to the humans and animals. Buddhir visheshaha. The only thing which we differentiate humans from the animals is that the intellectual power. Buddhir vihina naranam pashubhi samana. If the humans lose their intellectual power, if they don't utilize their intelligence rightly, then he will be similar to that of the animals. So ultimately, we are blessed with the intelligence. When we have an intelligence, even we need to think that how to utilize just that intellectual power to serve the nation and to serve the globe. So that is the reason here. So if you want to improve the character of humanity, so as a previous speaker was also saying that even Ayurveda, while explaining the Achara Rasayana, and even while explaining the importance of Swastha, they say Data Samaha Satya Paraha. aptopasevane bhavatya roga. See what data sama. So ultimately, each and every individual should have the character or attitude of serving the people. Dhana dharma karna hai. Uske saath saath even people should have the nature of speaking truth, because you know that during the time of COVID, many people, even though they were suffering with the COVID-like situations, they were hiding their complaint. Because of that hidingness, that may be the reason why it is started becoming from the endemic to the epidemic to the pandemic, because people, they started that if it has become the social stigma, because of that people were started hiding themselves. So it should not be like that. If you want to have, if you are a human and if you have a humanitarian character, then you need to be a truthful. And even aptopaseva is that what we get the guidelines from the government, you need to accept it. Government guided during the time of pandemic that you need to use the mask, you need to maintain the social distance. So we need to accept it, because many doctors are there. Sorry to say this, many doctors, even they didn't took the vaccination. When we have a guidelines from the APTA, when we have a guidelines from the government health sector, we need to accept without making any query, because even there are many doctors, even they didn't took any vaccination, then they were stubborn that they are saying that they may not be having any effect of vaccine, and it may have some disadvantages, it may produce any deleterious effect on the body. So these were some of the debates which were going in the minds of particular doctors, that it should not be like that, because if you may be prevented, but if you have if you have an infection, there is a more chance of spreading the disease from one person to the other person. So rather than that, we, as previous speaker says, that Vasudeva Kutumbakam. So we need to think that each and every person staying around us is the family member, and if you want to keep them healthy, ultimately we need to be healthy, and that attitude we get when you have the quality of humanity. So that is the reason. So if you want to develop the quality of humanity, then what you should have, how we can achieve, and every person can achieve the quality of humanity. So ultimately, one and first thing is that you need to be complete. You need to be complete satiety. That is, you need to be in the state of complete satiety, or you need to be have the contentment in each and every aspect of the health. It may be physical health, mental health, social health. When each and every aspect and facets of health are completely satisfied, then only you can extend the quality of humanity, or then only you can extend your care and love to the others. So here, if the person is physically fit, if he is not mentally fit, ultimately again he won't extend the service to the public. If he is physically, if he is physically affected, but is mentally strong, but again he can't extend the service, because he will be more he may fall sick oftenly, and he will be busy in taking care of his own health. So it should not it won't happen. That is the reason physically he should be healthy, and mentally should be healthy and sound, and along with that he should have a good rapport with the society. If he don't have any good rapport with the society, obviously he can't take the quality of humanity to the public. So he should have physical contentment, mental contentment. Along with that, even he should have a good social health. When all these facets are achieved, then only he can extend the quality of humanity. So if it is so, then which is this which tool we can use first to attain the health in each and every aspect, so that we can extend the quality of humanity. So ultimately, we know that yoga is the one science which not only helps to build your health, build your wellness, even it will help you to get the quality of humanity. So even we know that in Ayurveda, while explaining the स्वस्थ लक्षण समदोष समाविष्ट समदातु मलक्रिया प्रसन्न आत्मेन्द्रिय मन स्वस्थ इत्याभिधीयते. So प्रसन्न आत्मेन्द्रिय मन, when person will be having the well satisfied mind and soul, then he will be able to extend the quality of humanity. That is the reason. So if you want to physically fit, if you want to mentally fit and socially active, ultimately yoga is the science which support to maintain all these facets of the health, so that you can extend the humanitarian quality. So again, when we see about the yoga, when we see the history of yoga, there are numerous schools of yoga, modern schools of yoga, ancient schools of yoga. Especially when you see the ancient schools of yoga like Ashtanga yoga, which literally states about the Ashtanga yogas, especially Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. Even Hatha yoga is that which preferably focus on Shat Karmas and which focus on asanas, mudras, and bandha. Laya yoga, which focus on the self-aware and awareness on the breathing. Kundalini yoga, which focus on the Jagruta of the serpent power, which is present in the Muladhara chakra. So what is the purpose of schools of yoga? So again, according to the need of the person, you need to opt. It's not that each and every schools of yoga is applicable to each and every person. No. If the person is physically fit, though if you want to enhance his mental power, then he need to focus much on Laya yoga. So if the person is physically ill, then he need to first focus on the Hatha yoga, which delivers about the Shat Kriyas, Shat Karma, Nirgamas, Taula, Kafadosha, Maladika. So if the person is suffering with any Kafadika, Kafarogas, or Meda Vikaras, then you need to adopt the Shat Karmas so that you can cleanse yourself and you can become physically fit. If the person is, and even he can practice the Asana. Asana, again, it also says about the how you can remain physically fit. So once if you achieve the physical fitness, then you can proceed to the mental fitness, that is by practicing the pranayama, laya yoga, kundalini yoga, mantra yoga. Again, mantra yoga also has numerous benefits, not only in physical status, even it helps to maintain your mental status. So schools of main reason behind the highlighting the schools of yoga is that according to the need of the person, you need to opt. If you are physically fit, then you need to opt those modalities which will enhance your mental health. If you are physically and mentally, if you are active and fit, then you need to adopt those sciences which will help to enhance the social health. So when these schools of yogas are appropriately adopted, then you can attain the all complete health and wellness. If health and wellness are maintained, then easily you can impart this sense of serving the public. And one thing, very important thing, what I want to say is that Ayurveda says that Sukartam Sarva Bhutanam Matah Sarva Pravruttaya Sukam Dharmatta Vinacha Bhavati Tato Dharmo Paro Bhave. Exactly what they want to say is that Sukartam Sarva Bhutanam Matah Sarva Pravruttaya. Every pravrutti, every activity is given or done by each and every person is to attain the Sukha. But it is not mandatory that every activity what you are going to do, it is going to give the happiness. Only those activities which are dharma para, which are according to the dharma, which are according to the fundamentals, which are according to the doctrines of yoga. If you adopt such fundamentals, then only you are going to get the happiness. Because nowadays people are using or practicing yoga randomly. It is not according to the siddhanta, according to the fundamentals. Because fundamentals have clearly they mentioned how you need to practice, how you need to approach for each and every ailments. But people are randomly they practicing. In simple way, if I want to say that. While explaining, especially while practicing pranayama, everyone recommends that in each and every step of asanas, we need to focus on breathing, and along with that, we need to focus on the each and every body. We need to keep your awareness. This is the one of the simple theory. And another is that Yoga Shastra says that first you need to master the body, then you need to, after mastering body, you will be able to master your breath. Once if you master your breath, then you can control your mind. That is, chale vatam, chale chittam, nishchale bhavet. Yogi sthanatma apnoti tato vayu nirodhe. Once if you want to control your mind, your thoughts, you need to control your breath. That is the reason pranayama. So if you want to control your prana, you need to practice asana. That is the reason when you see the Ashtanga yogas, why the sequential order is arranged. First yama, niyama, then asana, then pranayama. So this sequence is supposed to be maintained always, but nowadays people are practicing randomly. That as per their will and wish, they will practice pranayama initially, then they will practice asana. At last, they will practice the meditation. So it should not be like that, because Ayurveda, yoga, and Ayurveda Shastra always says that we need to practice. We need to do all the activities according to the siddhantas. If it is according to the siddhanta, then you are going to get all the results. And even as I stated, if you are doing or if you are practicing any asanas or any, if you are accepting any science, without fundamentals, then obviously that is not the science. So that is the reason why nowadays yoga has become the workout, because the people lost the fundamentals. They are not at all using the fundamentals, they are using their skills yukti randomly, and because of that nowadays yoga has become more workout. But it is not the workout, it is the working. Nowadays yoga has become the all about the bending and demonstrating the very advanced series of asana. But yoga is not about the bending, but it is the bonding. And yoga nowadays it is became as a racing, it has become the competition. But rather than considering it is a competition, rather than it is considering as a racing, it is a facing ourselves. If you teach according to the fundamentals, and if you teach importance of yoga in a fundamental way, then people will accept it and they can gain all the health benefits. It may be physical, mental, social, or spiritual. They can attain and they can reach the highest status of the health. Because why I want to say is that most of the people, when we say that, people, they know the bright side of the yoga, but they don't know exactly what are the dark side of the yoga. Because there are numerous research articles. When you search in these PubMed or renowned and peer-reviewed journals in these databases, you will get lots of research work which says that if yoga is practiced and if it is not practiced according to the fundamentals, then it may give rise to the adverse effect. People, they don't know, because we know that many people, they will sit in front of the TV and they will demonstrate the Kapalabhati, and you ask every person to practice the Kapalabhati. Is it so? Because Kapalabhati is not indicated to every person. It has its own indications and contraindications. Who is supposed to say that? Even in when you see the protocol of yoga, it is very systematically arranged. They never mentioned about the very drastic asanas and Kapalabhati. Even they mentioned it is very milder way. But people, there are lots of videos which promote the people to practice Kapalabhati without assessing your mind and body. It is not like that, because yoga has its own advantages and disadvantages. When it is not done according to the Siddhantas, then obviously yoga may affect your body. That is the reason whenever you are practicing any kind of asanas or any kind of pranayama or any kind of science, it should be according to the fundamentals. So one fundamental just I would like to say here. So whenever you are practicing the yoga, so ultimately it should be in sequential order, as I stated. So Ayurveda, yoga says that Shat Karmam Nirgavastaule Kafadosha Maladika. First, we need to practice always Shat Karma. After practicing the Shat Karma, we need to proceed to the Asana. Asane Drude Yogi Vashi Hitamitam Ashanam. Gurupadishta Margena Pranayamam Samachare. Again, he says that after practicing Shat Karma, Asana. Once if you master Asana, Asane Drude Yogi. Once if you make your body by the asana, then Gurupadishta Margena Pranayamam Samachare. Then in the presence of Guru, you need to practice the pranayama. So after practicing the pranayama, again they mentioned that you need to practice the meditation. So this is the sequential order what Yoga Shastra says. So you need to abide to all the Siddhantas. We are not supposed to go against or contrast to the Siddhantas. If you go, then you are not at all going to maintain physical, mental, or social health. So here we are discussing about the how to develop the quality of humanity. That is only possible when you will be fulfilled in each and every aspect. When you are physically fit, mentally fit, and socially fit, then only you can extend the service to the public. So here, when it comes to the maintaining the physical health, health by the yoga. So again, these are different schools of yoga. According to different schools of yoga, if you think about the Hatha yoga, as I stated, it is a asana pradhana. So because of asana pradhana and Kshatriyas, to maintain the physical health, Kshatriyas are supposed to be adopted. Again, whenever you are adopting or whenever you plan to practice these things, it is a must that you need to take the help of a expert who is specialist in yoga and Ayurveda, and who is the good practitioner. Because nowadays many people preach, just they will teach the yoga, but they don't practice. Because yoga has lots of essence which can be explored when you start practicing. So you need to take the guidance from the Ayurveda Visheshagya, who is master of yoga. Why? Because all the concepts which are explained in yoga are tremendously, very beautifully, very in enhancing way it is explained in Ayurveda. Whether because Yoga Shastra believes on the Panchabhautika Siddhanta, Tridosha Siddhanta, Saptadhatu Siddhanta, main concept of these things are very well elaborated in Ayurveda Shastra. That is the reason, if you want to take the advantage of yoga, you need to take the help of Ayurveda Visheshagya, who is well in yoga and who is the good practitioner, then you can get the good advantage of the consultant. So here, so whenever you are practicing, if you are physically ill and if you want to improve your physical health, then Hatha Yoga, if you want to practice, start with Kshatriyas and asanas and bandha. These helps to maintain your physical health. If you want to practice Ashtanga Yoga, so Niyama, especially Niyama, again, this is that Shaucha, Santosha, and even Tapa, Swadhyaya, Ishwara Pranidhana. These are some of the Niyamas which again emphasize much on the physical health. Asana, Pranayama, in Laya Yoga, Shat Chakra, Jagarana. So these are some of the schools of yoga which preferably focus on enhancing the physical health. So when it comes to the enhancing the mental health, again in Hatha Yoga mudras, which are there are numerous Hasta Mudra, Kayaka Mudra, and even Adho Mudras. There are numerous mudra according to your need. If you want to improve the mental status, then you can practice the mudra which are explained in Hatha Yoga Shastra, and in Ashtanga Yoga, Yama, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So these are the some of the Antaranga Yoga, preferably Pranayama, Pratyahara, Dharana, Dhyana. And whereas in Bahiranga Yoga, Yama and Pranayama, these will help to enhance your mental health. So if you want to be sound from mind, then you need to practice Yama, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi regularly. And if you are a practitioner of Laya Yoga, so yeah, Atma Avalokana, that is self-realization, self-awareness. You need to improve your self-awareness. So this is the concept of Laya Yoga, which helps to enhance your mental health. In Mantra Yoga, again, Japa, Ajapa, Japa, there are numerous Mantra Yoga. Mantra Yoga not only help to maintain your mind, even it will help to maintain your physical health. As we know that Akara, Ukara, and Makara. When the person chant the Akara, a single syllable of Omkara, so it will enhance all the health of the lower part of your body. So when you chant the Ukara, so it will focus on the middle part of your body, and even it will help to maintain your middle part of your body. In the same way, if you chant the Makara, it will enhance all the organs which are present on your shoulder. That is, all head and neck part will be enhanced. So Mantra Yoga, again, it is beneficial in maintaining the physical health, mental health. So in such a way, we can practice yoga to enhance the mental health. If you want to enhance your social health, ultimately Ayurveda Shastra like Achara Rasayana, Sadvrutta Palana are essential. Along with that, in Yoga Shastra, especially in Yama, they mentioned that Ahimsa Satya, Asteya, Brahmacharya, and Aparigraha, that is non-violence, truthfulness, non-stealing, celibacy, and non-possessiveness. Imbibing these qualities when you practice Yama, so you need to you will be able to imbibe these qualities. Once if you imbibe these qualities, ultimately your social rapport will be improved, and you can improve your social health. Even like there are other concepts like Yoga Siddhikara Bhavas, Yoga Pratibandhakara Bhavas. If you stick on to these phenomena, then you will be able to enhance your social health. As a thumb rule, whenever if you want to enhance your physical health to achieve the well-being and to extend the quality of humanity, you need to practice each and every asanas or each and every yoga shastra in a sequential way, or it's in a fundamental way. So whenever you are practicing the pranayama, or whenever you are practicing any kind of asanas, always start with the systematic way. It should be sequential order, because asanas, some people will start with the sitting series, then later they will come to the standing series, then prone, and then some other asanas. It should not be like that. So it should be started with the loosely exercise, standing series, sitting series, prone series, supine series, then pranayama, then meditation. So this is the sequential order you need to do. And whenever you are practicing asanas or any kind of procedures of yoga, so you need to always focus on your mind and body to get the result. And every asana should be synchronized with the breathing. And whenever you practice any kind of asana, it should be ended with the counter pose. So again, after practicing particular asana for particular time, then you need to give pause to your body, so that you can again conserve the body and you can move on to the practicing of the second another asanas. So this is the thumb rule what you need to take to maintain your mind, body, and social health. So coming to the conclusion, so humanity, as I stated, that it is only found in human. So it's we are blessed to have the quality of humanity, but it all depends how you utilize your buddhi, how you utilize your intellectual power. So enrich it by providing the contentment to the all facets of body. So when you are physically happy, mentally happy, socially happy, then only you can extend the service to the public. So that this happiness or contentment is attained by yoga. That is, yoga is only the possible tool to achieve all the contentment of all the facets of health. Learn and practice appropriately, abiding to the fundamentals and consulting the appropriate yoga preacher. So by this you can attain the humanity and you can serve the public. Thank you and all for your patience listening. If there is any questions, am I audible?
Yes, sir, audible.
Yes, sir. Thank you, sir, for elucidating how humanity can combat pandemic situations and for providing research evidences related to that. Thank you very much.
Thank you.
It would be great pleasure to invite the exceptional and surpassing Dr. Padmini Tekur, Associate Professor, S. Vyasa, deemed to be University, Bengaluru, India. I invite Dr. Dhanashri Patil, Assistant Professor, Department of Integrative Medicine, Sri Devaraja's Academy of Higher Education and Research, to introduce Dr. Padmini Tekur. Over to you, ma'am.
Thank you, Dr. Nuzul. I'm glad to introduce Dr. Padmini Tekur. She's currently working as an associate professor and yoga therapy consultant at SDUAHER Yoga University over 20 years, where she consults a variety of patients with chronic stress-related elements and also with back pain. She has treated thousands of patients with back pain for the past 2 decades. Dr. Padmini Tekur holds an allopathic MBBS and a PhD in yoga with more than 15 research publications in leading national and international journals. She has guided many MD, MSc, and PhD students on various topics. Having more than 20 years experience in learning, practicing, and teaching yoga, she has extensive theoretical and practical experience in yoga. She teaches the bachelor's, master's, and doctoral students as an associate professor in the SDUAHER deemed to be university. She specialized in conducting stress management programs to various leading corporations. She has traveled extensively to many countries all over the world, conducting seminars and workshops on yoga therapy. She has many awards and citations to her credit. Dr. Padmini Tekur believes in not only practicing yoga, but leading a life with spirituality and Vedanta. She is a student of Vedic philosophy, Vedanta, trained by Swami Vishwarananda, Swami Maheshananda, and Nagendraji, Dr. Nagaratna, Raghuramji, Subhadra Didi, and Mohanji, who are leading spiritual masters in the field of yoga. Thank you, Didi. Over to you, Didi.
Thank you so much, Dhanashri. I take this opportunity to thank Dr. Nitin Patil, who is doing such wonderful work in your institute for organizing Samanvaya. And in fact, the program is so well organized. You have such wonderful speakers. I was learning a lot from all the speakers who spoke earlier. The topic for today, International Day of Yoga, Yoga for Humanity and Wellness. There is a beautiful shloka in Ishavasya Upanishad which summarizes this. Ishavasya midam sarvam yatkinta jagatyan jagat. Not only for humanity, it is for the entire universe, all the creation, the entire creation that yoga is, Vedanta and yoga apply. So today, the topic of discussion which I am going to present is integrated yoga for wellness. There are many schools of thought on yoga. Dr. Kashinath has mentioned so beautifully. Some people just do asana, some people do just pranayama. So here I am presenting integrated yoga, which is the hallmark of SVyasa Yoga University. We specialize in integrated yoga. Some people are very good in the intellectual part, the Vedanta. Some are very good in pranayama, some are good in wonderful, body bending, acrobatic like gymnastic like asanas. Some people are good in meditation. But our Guruji, who has designed this integrated yoga, is good for all the levels. I know there are a lot of experts sitting in the audience. So a little bit for the beginners. We all know there are 4 Vedas: Rig Veda, Yajur Veda, Sama Veda, and Atharvana Veda. The Vedas are divided into 2 portions. The first portion is called as Purva Mimamsa. The second portion is called as Uttara Mimamsa. Purva Mimamsa has a lot to do with rituals. Yagas, yajnas, homas, havans, puja vidhana. Uttara Mimamsa is otherwise known as Gnana Kanda. This is otherwise known as Upanishads. And Upanishads are the science. Our Guruji says they are the science and yoga is the technology. Our rishis and munis would be doing a lot of internal research. Somebody says, I believe in something because there's a scientific backing for it. Yoga and Vedanta have science behind them. The laboratories were within. Our rishis and munis did internal research. It was not like they just said, okay, do Nadi Shuddhi Pranayama. They didn't just say that. They did it on themselves. They saw that it makes a lot of difference in the state of my mind. They kept on working on it. Our Guruji says, hundreds of years people have worked on it. So yoga has a very strong scientific evidence. Integrated yoga means I work on my body, my prana, my mind, my intellect, and my bliss layer, so that I am fulfilled in all these levels. That is what is integrated yoga. Let me show you some slides. This is integrated approach of yoga therapy for lifestyle diseases. But first, let us look at integrated yoga for wellness. What is the concept of stress? How do I maintain wellness amidst all the stressors that I am subjected to? It could be environmental, demanding situations, imbalances between individual and environment. The third thing is my response or my reaction to that particular stressor that I was exposed to. Physical stressors are weather, diet, trauma, infection, toxins, pollutants. Emotionally challenging situations are, we are not talking about diseases now. We're talking about wellness for a normal person. All these are what a normal person faces. Family, office, calamity, conflicts, interpersonal relationships, unfulfilled desires. Somebody said, I wish I go to a place where none of these disturbances are there. For this, one of my Vedanta teachers said, she gave me a drashtant. It seems once a family went to the sea for a vacation. They were all, all the people were entering into the ocean and then taking a dip and coming back. There was one person, he had a towel in his hand and was sitting on the beach. So somebody asked him, I've been watching you, your whole family members have gone to the ocean and they are playing in the waters, they're taking a dip. Why, how come you're just sitting on the shore? He said, look, I'm waiting for all the waves to calm down so that I can enter into the sea and take a bath. That is what happens when we think I should not have challenging situations in family, office, calamities, conflicts, interpersonal relationships, or unfulfilled desires. It is how I respond. I may get angry, I may develop fear, I may develop phobia, tension, suffocation, feeling anxiety, depression, discomfort. Some are recognizable, some are not recognizable. When there are imbalances between an individual and the environment, abilities and demands to cope, needs and opportunities, goals and actualities, desires and resources, reality and fantasy come into play. Integrated approach of yoga for health. It is a journey towards healthier and a happier life. What is health? Is it the absence of disease? Health is a state of well-being at the physical, mental, social, spiritual, not merely the absence of illness or infirmity, says World Health Organization. Plague and cholera are replaced by heart attack and cancer. These are called lifestyle disorders because of problems in diet, lack of exercise, bad habits, and stress. The mind plays a very important role in handling stresses and our response to a particular situation. One of our founders, Shastriji, used to say, Kartum akartum anyatha kartum. Supposing somebody says, look, you are such a dumb fellow. Normally what happens to us, we get very offended. Then you will get angry. You'll say, you are very stupid. We tell the other person. The second or first option is that. The next option is, you just keep quiet and sulk. You say, oh my God, I'm feeling so bad. The third option is my response. I can tell the person, look, I know what I am. You can have your opinion, but I am not going to get unduly perturbed with this kind of a remark. So let us see at all the kosha levels, how does integrated yoga help? Now, disease comes from illness, we come to wellness through yoga. Yoga is defined as speed in the Shastras. So you have internally demanding situations, externally demanding situations which act on the psyche, and what aspect of the mind is the problem? Mind has perception, analysis, IQ, memory, but it is the emotions that create a lot of problem. Positive and negative emotions are there. Negative desires or Arishad Vargas, Kama, Krodha, Lobha, Moha, Madamatsarya. Dr. Kashinath put it so beautifully. No Yamaniyama in today's life. You know, the normal, what Vedanta talks about, it is Dharma, Artha, Kama, Moksha. They didn't say Artha, Kama, Dharma, Moksha. That means dharmic way of attaining everything is very important. It is not just getting what I desire. Krishna says, desire is like wildfire. If you try to satisfy it by pouring ghee into it, the desire blazes forth. I need to sublimate my desires, not suppress. If you suppress, it causes illness, it causes frustrations, it causes suppressions. So all these Arishad Vargas, I need to sublimate. Let us see how we do it. Concept of stress according to modern medical science and yoga. Demanding situations physically could be injury, infection, pregnancy. Pregnancy is a physiologically demanding situation. Emotionally demanding could be outside. It could be office, family, finance, calamities. Internally target sensitivity and ambitions. Modern definition of stress by Dr. Selly and Levi, they said, stress is a conventional, non-specific, basic response pattern to a demanding situation. That is, look at this lady. She doesn't have any illness, but is she in the stage of wellness? Wellness is complete health. Sri Aurobindo said yoga is a tool for total personality development at the physical, mental, social, spiritual levels, which completely coincides with WHO's concept of health. This lady is like us, normal working lady. She wakes up early, problems in the job. She has to take care of kids at home, works late. All this is happening to all of us. How do I maintain that samatva bhava, that wellness quotient in me, despite all my demanding situations? Stress response is a mandatory reflex for the very survival. There are 3 stages of stress response. It is called as stress adaptation response. The first step is stage of alarm. The person feels very threatened. The second step is stage of resistance. The third step is stage of exhaustion, where the person feels totally tired and not able to carry on any more of that particular task he or she was taking up. There's a beautiful bell-shaped curve in statistics that shows that if you increase a little bit of stress level, actually your performance is better. I'll give you an example. If there is an exam, if there's no exam, there are very few people who will actually study. But if you all study, if somebody tells you, you have 3 exams per day for the next 3 months, none of us can cope with this kind of stress. Because the bell-shaped curve says, as you increase the stress, you increase your performance. After that, there is a plateau. And if you further increase the stress, the performance slowly comes down. And later on, you're not even able to perform properly. Stress response is a mandatory reflex for the very survival of the individual. When psychologically there could be fear, anxiety, alertness. Physically, the heart rate increases, blood pressure increases, respiration increases, muscle tone and muscle work increases. Blood to the digestive system is reduced. Eyes are wide open, pupils dilate, sweating is there. We see that manomaya kosha, there is anger, fear, tension. There is sympathetic hyperstimulation. In fact, when we tell our patients or even people who come just to relax and rejuvenate, the sympathetic hyperactivity is there. So we need to bring them to the physiological baseline. Now, supposing somebody says, I go to sleep every day, I wake up. But that is not giving enough rest or relaxation, which pranayama and meditation can do. That is what we notice. As it happens in modern life, large number of demanding situations, high sensitivity and sharpness, perfectionist attitude, targets to be achieved. If you don't allow the system to regain its normalcy, stress overtakes the individual. Stress imbalance is there. So normally there is a balance. The sympathetic stimulates, the parasympathetic relaxes. But it so happens that when there is a stressor, there is a stress imbalance. So the system stabilizes. From wellness, I come to illness. I have increased blood pressure causing hypertension, increased glucose levels causing diabetes, muscle stiffness causing back pain, inflammation in joints causing arthritis, higher acid secretions causing ulcers. There are two concepts from traditional texts what we need to understand when we have to understand how yoga works for wellness. First thing is understanding the body. Am I just the physical body? When I was doing my MBBS, we studied so much about the physical body. We dissected the body, studied osteology, histology, embryology, histopathology. We studied so many things. But yoga and Vedanta say the body is not me. That is not the only thing that defines me. So let us see what do we have. The understanding of ourself according to Panchakosha Viveka and definition of stress. The koshas are supposed to be layers. So Taittiriya Upanishad says we are made up of 5 layers. Annamaya kosha, the physical body. Pranamaya kosha, the energy layer. Manomaya kosha, the layer of my mind and emotions. Vijnanamaya kosha, the layer of my intellect. And Anandamaya kosha, the layer of bliss. What is the definition of stress? Yogic definition is stress is speed. So we have seen this already. Positive health mentally, I need to handle my Arishad Vargas. Dr. Kashinath put it so beautifully. Yama Niyama are very important for wellness. I can't be in the disco till 3 a.m. and I can't do whatever I want in life. I can't have a licentious life and then expect to have good health and wellness. Yama Niyama form the first step. That doesn't mean you should not go to a disco or to a restaurant, but having Indriya Nigraha plays a very important role. The Gita model says, how do we move from wellness to illness? Thinking of objects real or imagined, Dhyayato Vishayan Punsaha, desire comes up, Sangasteshu Upajayate. Infatuation, it leads to infatuation. Kamat Krodho Vijayate, leads to anger. Krodhat Bhavati Sammohaha, disturbed awareness, loss of memory, Smrti Vipramaha, mental illness, Buddhinashaha, Pranashyati, will lead to destruction. So wellness as a beautiful concept gets disturbed when I allow Vishaya. What is the meaning of Vishaya? Vish ke saman hai. So Vishayan Punsaha, all these are objects of attraction. If I am not able to handle that, ultimately I will be led to a state which is not wellness, and that is illness. Psychosomatic problems come up. What is the solution? So integrated yoga says not only physical, pranic, but emotional stability is very important. Then the question comes, what is yoga? Yoga is the skill to slow down the mind. Manaha prashamana upayaha yogaha, said Vasishta. Yogaha chitta vritti nirodha. Yoga is a technique to gain mastery over the modifications of the mind. Stress is a response, not the situation. You can change the response, not necessarily always change the situation. I tell you something very interesting. It's a little sad what I heard. I teach a lot of international students. Many of them come to Prashanti. There was one person, he came from Italy And then he told me, I'm working in Switzerland now. He was an Italian. Then they said you have to teach him certain things. I was having a discussion. That boy said, you people are so lucky. Not boy, he was about 45. I said, why? He saw my mother. He said, so lucky. I said, in India, everybody has mothers, elderly, grown-up women are at home. He said something very sad. After 20 years in Europe, they will show a picture of Madonna with Jesus and say, this is motherhood. I mean, there's wonderful advancement in science in the West. There is amazing research that is happening. But the Eastern philosophy says you can change your response and not the situation. If the woman cannot get along with the husband, you don't change the husband. You adapt. Of course, you can't say this to every situation. If there is domestic violence, all that, you can't say this. But essentially, why in our country marriages are relatively more successful? Because there is an inbuilt system which says you can't change the system. How many husbands can you change? How many bosses can you change with your job? Do you know the biggest thing in US is people leave jobs. They have a lot of problems there. There are very few people who stick to a job like how they do. For example, I am with SDUAHER for the past 21 years. So that is why you cannot change the situation always. And how are you sure the next husband you get is somebody who is compatible with you? So you can change the response, though you cannot change the situation, because that freedom is inbuilt only in man. If I have a child that is difficult, what is it I need to do? I need to become more patient. I adapt. Yoga is all about self-management. I find a situation difficult. That means there is some erroneous zone in me that needs correction. And you will see, Wayne Dyer says, obstacles are opportunity to grow. The moment you overcome that particular weakness in you, the obstacle disappears. That is how it functions. Kartum akartum anyatha kartum. I have the ability to respond and not react. So let us see, stress is common in the world, and we have done a lot of research on a particular meditation that is called cyclic meditation or SMED, where we have shown that 22.5 minutes of cyclic meditation can give you 6 hours of deep sleep kind of relaxation. We measured the oxygen consumption and found that 32% of oxygen consumption was reduced. That means I'm taking lesser amount of fuel to run my system. That means I'm more fuel efficient, I'm more rested. That is what we have done. Yoga gives deep rest to the mind and the body, and the prana and the intellect. So integrated yoga means for the body, I do asana, kriyas, diet. For the prana, pranamaya kosha, I do pranayama. Pranayama brings about indirect autonomic balance. There are a lot of papers published in our institution where we have shown that pranayama can bring about indirect autonomic balance. Nadi Shuddhi pranayama, Brahmari, sectional breathing, full yogic breathing, Nadanusandana. So I work with all the layers of my existence for wellness. So some relaxation techniques are there. Deep relaxation technique, DRT, instant relaxation technique, IRT, quick relaxation technique, QRT, CMS cyclic meditation. I give deep rest to my body-mind complex and move higher in wellness. Samatvam yoga uchyate, equanimity, stability, balance, harmony, equipoise. This is what I achieve by yogic practices. Yoga karmasu kaushalam. Yoga is a special skill in action, action in relaxation, duty sense, selfless action, unattached action, no anxiety for the results of action. Sometimes people think, oh, these people want slaves, they don't want to pay people. And then they say unattached action, selfless action. No. Krishna did not say, don't take your paycheck home. He said, don't get unduly perturbed while you're acting. The most important thing you need to do is have an element of relaxation while you're working. Like total quality management is a step nearer to yogic method of working. They told the person who's working, don't worry about the car right now. You're making a nut or a bolt for the car, focus on that. Then think of the bigger picture, the car. So in the same way, if I am able to be relaxed, think of the process rather than the product. TQM did that. That is why Japan became an economic superpower. But there was nothing about the person who was working. Yoga says the person who's working is also very important, just like the product that he or she is producing. Holistic healing and lifestyle management through diet, exercise, regulating my habits and stresses, and working on my mind. Pranamaya kosha, corrections at all the levels of existence, that is yoga therapy. Diet. Why is it that, sometimes my students who are young, I don't blame them. In our younger age, we've done all that. They say, Didi, oi sukha roti, dal sabji. They want aloo all the time. They want nice fried food all the time. They're young. But we believe yogic diet is lesser in variety, lesser in quantity, and eaten with good company, with prayer. I cannot have a buffet lunch every day. Of course, we also go to restaurants and have buffet lunch, everything, but we don't do it every day. Annamaya kosha have diet regulation, kriyas cleansing techniques. Asanas are very important. They are called special techniques. Asanas massage the internal organs, improve circulation to the internal organs, and then improve the mobility of the person and flexibility of the spine. Pranamaya kosha, pranayama imbalances are corrected. When one goes through the wear and tear of life, we have a lot of stresses coming in and affecting us. Pranayama helps us in bringing about a autonomic balance. Pranayama brings about indirect autonomic balance, and meditation brings about direct autonomic balance. Coming to Manomaya Kosha, Dharana, Dhyana, and emotion culturing, meditation, there are such beautiful papers written by so many people. Please read about meditation. Whether it is Brahma Kumaris or heartfulness or Om meditation or anything, you will see that it reduces the sympathetic hypertonia drastically. And then there is such a lot of feeling of well-being, wellness. Osho has written a book, Meditation Instead of Medication. So that is what one needs to do. This, meditation is such a vast subject that you need to study it for a long time. Vijnanamaya Kosha. Recently, I was in a holiday to Chennai where I was staying in a Vedanta ashram. I met the monk there, the senior most monk in that ashram. He said something so beautiful. He said self-knowledge. Swami Dayananda Saraswati said, self-knowledge about if you don't have and you just meditate, what will the answer come from within when you ask the question, who am I? It will say, I'm one small fellow, one miserable fellow. But if you have Shravana, Vijnanamaya Kosha operations are very important also, because the world is seeing yoga as asana, pranayama. Meditation, notional correction is very important. Happiness analysis is very important. I understand that happiness is a state of mind which I can have with or without the props. Now, what is the situation? I need a Mercedes Benz. I need a penthouse in Pedder Road in Mumbai, or I need to have some place in New York where I have a plush apartment. I need a beautiful wife. I need a big bank balance. Only then I will be happy. Yoga and Vedanta say happiness, you can have it here and now when you have self-knowledge. Once you understand that, the insecurities, the doubts, the troubles we face will all disappear. So Vijnanamaya Kosha operations are also very important for wellness. Anandamaya Kosha, Karma Yoga. I'm doing all my activities in bliss, happiness. So this is integrated yoga. Diet, there's no time now. It's full of vitality. Sattvic diet is given. Kriyas are very good. Asanas, Pranamaya Kosha, correcting the prana imbalances. Breathing techniques are given. Slow, deep breathing, mastery over excessive speed, balancing of prana, reduce sympathetic tone. Now, this is what I see. These are all types of breathing. Yoga has self-correction with awareness and practice. Ayurveda, Tridosha, balance and lifestyle with medicine. Homeopathy takes up to vital energy balance, lifestyle with medicines. Acupuncture removes chi imbalance and removes blockages. So that is why stress and excessive speed, cyclic meditation gives rise to deep rest. Meditation gives rise to divine mood, calmness and rest. Now, emotionally, what do I do? Change, our Guruji says, change the software of your emotions. How do I change the software of my emotions? By converting violent emotions into softer emotions. Changing anger and irritability to pardon. There's a Chinese proverb which says, if you want revenge, dig 2 graves. One for your enemy, you want to kill him, and for yourself, because you're burning with that revenge, it will burn you. So pardon, faith in divine, acceptance, confidence, all these things are softer emotions. Surrender is expansion. Now, analyzing sukha, is sukha in the objects of enjoyment, or the example given in Prashanti, which Dr. Nitin Patil and Dr. Ashwin are here, and Madam Dhanashree is here. They've all heard it so many times in Prashanti. Sukha is not in the objects of enjoyment, because one of the monks says, supposing today you're happy with the Maruti, after a few days you want a Honda City, after that you want a BMW, it scales up. And what are you in that process? You're getting troubled, agitated, moving away from wellness. The wellness contentment is one of the important factors which yoga and Vedanta teaches to attain a state of wellness. Realizing the truth of the Upanishad, tuning into the infinite silence, the core of the inner being, that is the Anandamaya Kosha. So for meditation, dharana and dhyana, Dhyana, there is single thought, slowness, wakefulness, awareness, effortlessness, expansiveness, lightness. That is what meditation does and propels us into wellness. Devotion, bhakti, being in the presence of your Ishtadevata. That is bhakti. Emotionally, from jealousy, I come to acceptance, to appreciation, and that is how Karma Yoga teaches us. So this is a little bit about research in our institute, Anveshana. We have a mission and vision to make yoga a socially relevant science, to combine the best of the East with the best of the West. Our Guruji admires research of the West, organizational skills, everything. So we are not biased and say, no, India is very great. The whole world is great. We need to take the best from the West and combine it with the best in the East. Swastha Samaj, that is why we need to do that. Arise, awake, and stop not till the goal is reached. From animal level of instincts, I come up to normal human being, where I have discriminatory powers. Then I become a greater human being with higher powers, and I merge with divinity. So these are some of the recognitions of SVS. I invite all of you to come to our center and please visit. You can do courses with us. You can stay for wellness programs. We have areas of research, life science, physical science, spirituality, yoga and management, yoga and humanities. So humanities management, we have molecular biology, psychophysiology, cognitive neuroscience laboratories, and we have shown how meditation, all these are our findings in our laboratory. So you're most welcome to come. I think I will stop at this. So yoga as an integrated yoga is the answer to wellness. If I just do asana, I'll be physically fit. If I just do pranayama, I will be better a little more. But if I do all the aspects of yoga, integrated yoga is the answer to yoga and wellness of today. So I need to read a little bit to correct my notions. And then this is how I am. Integrated yoga, bringing me to wellness from illness, from darkness to light. Thank you so much. Thank you. Any questions?
Ma'am, there is a question in the chat box.
Okay.
Shall I read it for you, ma'am?
Yeah, I'll just check the chat box.
How to measure Panchakosha in our
How to measure?
Yes, ma'am. How to measure Panchakosha in our body?
See, and that is the problem with science and spirituality. We always think we have to measure. Panchakosha, in fact, our Guruji says, our Manomaya Kosha could be miles in length. Let me tell you one thing. Science has not yet progressed to a level where they can measure the Manomaya Kosha. It is not the deficiency of spirituality. It is that science is an embryonic stage. We are not able to measure prana. Now we are getting these equipments, Kirlian photography, GDV, which are measuring our auras. So techniques in science have not yet been advanced enough to measure Panchakoshas. Okay. Thank you so much. Yes, Kavita, beautiful thing you said. Integration, that is what Dr. Nitin Patil is doing. In an allopathic setup, he's working so beautifully. and bringing about integration between science and spirituality. He himself is a physician with an MD and PhD, so he's able to integrate. We need the science. I'm an allopath, so we need science and spirituality. For what? For integration, so that we have a healthier society, healthier people, and we are able to provide good health care. Not only health care, we are happy. That is the most, in fact, any Vedanta teacher, Ramakrishna Paramahamsa used to say, if there's a Vedanta teacher with a long face, he must be having a tummy ache. That is what he used to say. A person in Vedanta and spirituality is filled with Ananda. Why we need spirituality? So that all the people in the world live with happiness, peace, and love. That is the purpose of spirituality. Not to develop a halo around my head. Initially when I was a beginner, I used to behave like, hum log satsang jate hain. Then my teacher laughed. You're thinking you're above other people. That itself is not spiritual. So why do we need spirituality? So that we are all happy in life and move towards divinity, which is the purpose of human life. Okay. Thank you so much.
Thank you, ma'am. Ma'am, you enlightened us about stress, stressors, stress responses, and concept of stress. You also gave a clarity to how to overcome stress, which is a key component in the present era. Thank you so much, ma'am.
Thank you, Ma. Thank you. I thank Dr. Nitin Patel and his team who are doing amazing work in an allopathic setup. Not easy. No, he's doing amazing work. Thank you so much.
Thank you. I feel so energized to invite a seasoned scholar and a navigator of this flagship of knowledge, an eminent personality, Dr. Satyam Tripathi, Director, Union Yoga Ayurveda, Singapore. I request our resourceful Dr. Dhanashri Patil, Assistant Professor, Department of Integrative Medicine, Sri Devaraja's Academy of Higher Education and Research, to give an introduction regarding Dr. Satyam Tripathi. Over to you, ma'am.
I'm happy to introduce Dr. Satyam Tripathi. He did his undergraduation in Ayurveda and MD in Yoga and Rehabilitation. He has been undergone training of Yoga Therapy Instructors Intensive Training Program from SDUAHER. He has more than 9 research papers in his credit. He authored 2 chapters in a book, Innovative Approaches in Type 2 Diabetes, Ayurveda and Yoga Therapy for Allergy, Asthma with special reference to Shwasa. He presented many papers in national and international journals. He is having very vast professional experience in the different fields of yoga. He worked as a research coordinator at SDUAHER, as a course coordinator for MD and PGDYP programs at SDUAHER Yoga University. He is a secretary of Swami Paramahansa Swastha Shiksha Evam Paryavaran Samarkarshan Samsthana and working as a national coordinator for stress management program. He worked as a guest faculty for Wasabi Yoga and Wellness, a unit of Wabi Sabi, Singapore. He is a reviewer for many peer-reviewed journals. He conducted many workshops on yoga and Ayurveda for corporate sectors. Presently, he is a director of Union Yoga Ayurveda at Singapore. With this brief introduction, I welcome you, sir. Over to you, sir.
Thank you very much for introducing me to these eminent panels of listeners and speakers. So we are here to understand and talk about yoga for humanity and wellness and how we integrate our entire yoga and holistic sciences. So what I can share is how and what we think here in Singapore. That's more important for all of us to understand, because what reality is and how do we perceive are 2 different things. So to me, and to all of you, like, how do we perceive here and how do we understand from the mind of locals in Singapore? So when it comes to two segments, one is humanity and one is wellness. So the first segment where we talk about humanity, yoga is the base. Because yoga is the one which talks from the very beginning that it's all about aligning our body, mind, soul with Paramatma, and that's how what we are actually supposed to practice. And when we do namaste, namaste itself means that I salute or I do nama to the spirit inside you. And very well said by Adi Shankaracharya, which is accepted here, that spirituality is made up of two words, spirit plus actuality, which means I can see that divine spirit in actuality in you. And that is what is spirituality. And the beauty is that we look forward to that. Because when we talk about a society where we can have people of different caste, religion, race, creed, living under one roof with politely, with so much of non-violence and happiness, with growth, it can only happen when we can follow this very clearly. When one person or one human being respects the independence of another human being, and your independence of speech, actions, work is not affecting the independence of any other human being, then only we can have humanity stable in any country or in any society. Question always is what is society and where is society? The reality is each one of us makes society. And Newton's law of motion says that action has equal and opposite reaction. So if we start behaving properly, we start behaving more civilly, more culturally, automatically the culture will start creating a change in the other person in the same way. We have recently celebrated World Yoga Day on 21st, and it's amazing to see that more than Indians, other races were there together. It was raining. Many of them volunteered to bring raincoats to make sure that all these people who are trying to do yoga, they should be taken care and the entire program should not get hindered. These people who were trying to serve all these may not be yoga students or yoga teachers, and sometimes they were not even those whom we know. But what they have understood through yoga or by the advertisement of yoga is something very pure. And that feel of purity creates change in human being. So when we say yoga creates magic, it's all about that thought, that feel of being the part of purity. No matter how much impure is the water, how much impure or how much poisonous is a liquid, but once it combines with milk, it looks milky. So that's how yoga is. So what are we trying to do is, when we say that integration is not only about combining modern medicine with Ayurvedic medicine and Ayurvedic medicine with homeopathy with something. Actually, integration has a very big meaning and very vast meaning. Integration is not only about two therapies, it is also about two culture and two thoughts, two belief and multiple beliefs. And when we integrate all these things, when we talk about stress, actually what is stress? A response for certain situations. Okay, that's very scientific answer. But question is, what are all these things? Why do we need response? Because somewhere, somehow, our mind is struggling. Our mind is not ready to accept of whatever is happening in the form of religion, in the form of caste, in the form of creed, in the form of countries. like this country is better, that country is not good, this country is not good, this human being is not good. But why is it so? Like even if we are talking about what is happening in Ukraine because of Russia or because of other European countries, so there is a struggle. And this continuous struggle is because from one side, people don't accept of whatever things are with them. Sometimes the life which we are living, for the other person, that life might be on prayers. The other person is praying that God give me that much luck that I can live life like that person. So that is very important for all of us to understand. So this kind of different thoughts, when we start integrating and we are putting it into one and we start accepting it, we are actually doing yoga for humanity. We are becoming more human. Great human, divine human, that comes later. Let's be first human. When yoga is teaching us that, yoga is trying to bring that sense in us, where we understand that the first feeling is whatever I have, it will go. So ego is for what? Whatever we are getting today and whatever we have today, it was with someone else yesterday. And today I have, and tomorrow someone else will have. And that feeling of, and that understanding when we have, we start leaving the ego behind and we start becoming more human. So that is integration. Because when we integrate these kind of thoughts in our mind and this kind of behavior with us, we are actually in the process of yoga. Supreme yogi, when we say Krishna was a supreme yogi, because Krishna was continuously having a clear thought that after doing all an entire teaching, which I am going to do with my Bhagavad Gita, at one point of time, I am the only one who is going to be a destroyer of entire Dwarika. An entire thing will be destroyed and I myself will be destroyed and I have to leave the curse of Gandhari. He knew it. So understanding that everything will be destroyed and then also I have to do my job, and when I'm doing my job, in that entire process, I have to make sure that the job is done properly, but my ego and my greed should not take over me. So that feeling is what we get from yoga. And integrating that into our behavior itself is the process of developing us into a human. And what character we develop as a human is humanity. So integrating here is all about how we all can be better human being for others. And if we have better human being, if we are better human being, and if we have that in our society, automatically the health will start. When we see that average lifespan of many countries are higher, we talk about Edinburgh, we talk about Netherlands, we talk about New Zealand, we talk about even the poor country, which can be Bhutan. So when we say that average lifespan there is better, so is it because they are very rich or something, or the resources are very high? But the reality is they are really well. When we say wellness, they are really well, because half of the time human being is struggling that the person who is beside me or who's in front of me or who is working with me, that person will be honest to me or not, the person I can trust or not. So when we say that we follow a yogic behavior and we make overall society, integrative society with yoga, do you know what happens in these countries? People are not stressed with these kind of day-to-day activities. Their mind is actually free from that. They are able to focus more on their productive work rather than thinking of how to be safe. It can be any country. We don't know which country we should talk, but the reality is half of the time people are worried about certain things which are non-productive. And these non-productive things gives us stress. These non-productive things which creates jealousy gives us stress. And because of non-productive work, we are into a state of disease. Sometimes we understand what Vidur said in Mahabharata through Bhishma, that division also sometimes is a solution, but when it is done for peace. So that's the reason why we have divided different pathies. We said Ayurveda, we said yoga, we said homeopathy, naturopathy, modern medicine. So there are different division in pathies, but the reason of division of these pathies was to bring calmness, peacefulness, and every science should grow into a proper research. But if at certain point of time, these pathies separately, they are not able to bring peace and they are not able to bring proper health to us. So it is a time that when everything has to again mingle and become one. And that's the age of integration. And that is what all developed countries are thinking about. They understand the importance of mind. They understand the importance of being proper civilized. They understand the importance of intellect, knowledge, wisdom. They understand the importance of focusing, defocusing. They understand the importance of pranayama, which includes breathing. And they also understand the importance of change in the lifestyle. And with that, when we use medicine, it will be more and more effective. We call it in the one form as Panchakosha. So what I'm seeing here is, we call it as yoga, or we don't call it yoga, but the entire society is moving towards it. When the entire world was saying that what can be done during COVID, Singapore government and healthcare system was talking about wear mask, and no matter how strict is the lockdown, but you all have to go to the park. Because lockdown should not make your life sedentary, and for people in Singapore, parks were open with mask, of course, with social distancing. So this was also a message which we were all getting, that we cannot be into a sedentary lifestyle. To overcome from one problem, we cannot invite another problem. And yoga says the same. Physically, I do. Yoga has a bigger meaning, but physically it says that we have to break down that chain of sedentary lifestyle. Sedentary lifestyle is in the mind, sedentary lifestyle in the body, and we have to break that chain. Then only we will be able to be healthy. The sedentary lifestyle in the mind, which we talk about in yama and niyama, and sedentary lifestyle in the body, which we talk about in asana, and sedentary lifestyle in our energy system, we talk about the same in our pranayama, and sedentary lifestyle in our thought process of stagnating our older memories. It is there in pratyahara as well as in others. So altogether, this is a very good theme on which we are trying to have more talks and more understanding. I personally believe that this is actually the base of any healthcare system, because whenever we talk about stress, stress comes from less from nature, but more from our own society and our own human being. And if we have to really overcome from the stress, it is not only by doing the dharana or dhyana. That is not only the process, because there are a lot of contradictions where we talk about dharana and dhyana, which Dr. Padmini Tekur was just saying, that if there is a domestic violence, you cannot go towards pratyahara, dharana or dhyana. You have to take action. So beyond that, what? Beyond that is changing the entire mindsets of people, and that is what yoga can do. If we have to overcome from the stress, working on acceptance is important, but changing the entire civilized system into a better civilized system where humanity plays the first role. We are not Indian, we are not Caucasian, we are not European, we are not Chinese, we are not American, we are human. And when we are not even boy and we are not even girl, we are actually human. And that segment, when it starts getting embedded inside us with the help of yoga, we actually are integrating a healthcare system. Psychosomatic disorder, when we say psychosomatic, starts from the mind. Mind means stress. Stress comes from where? Stress in the job. What is stress in the job? Is it competition? Actually, if you look into that, really competition doesn't give us stress. Actually, competition makes us better. We actually start enjoying the competition. The problem is, you are ready to do the competition, you are ready to show what is good, but then you start thinking that, can I express this? Will my boss will be happy? If above my boss, there is one more person, will that person be happy? What he will think and what she will think. And with all this, actually we get stressed. We are not able to do best what we have, and we are not able to grow our potential because the society is disturbed. So yoga is a process to correct this level, this mindset of the society. And that will ultimately increase the wellness in us. So thank you very much for having me here. I don't know how strong was my message in this conference, but this is what I wanted to say. Namaste.
Thank you, sir. Sir, there is a question from the audience.
Yes, please.
Is integration the only way for wellness, sir?
Honestly speaking, we should see, it's a vast thing which I have to talk on this. See, integration, when we talk about integration, it has to be done in different ways. First of all, when people say that why is yoga behind in terms of medical science, or why is Ayurveda behind backlogging in the form of medical science, the actual answer is we are not integrating it with technology. Do you know the saddest part? I'm an Ayurvedic doctor. I'm a yoga consultant as well. When I see that we are still today quoting what Charka has said 5,000 years ago. I know it is good that we are proud of Charka, but in one way it is also a sad thing that Charka has done everything. I have done nothing. You know, it is important to really say that according to Dr. So-and-so, which is 10 years elder than us, who has given us a new formula. According to Dr. So-and-so, 20 years ago or 15 years ago, who has given us a new formula in Ayurveda. But the question is, nobody has given any new formula. And why is it so? Because we are not actually connecting the entire technology with our Ayurveda science. And the reality is, till we don't connect the technology with science, no science can grow fully. No matter how much potentiality you have in your science, it will only grow when you put technology into that. Knee keyhole surgery on the knee, the surgery was surgery, but when they started putting more technology into that, so from open surgery, we started looking into keyhole surgery. With keyhole surgery, we started looking into microscopic surgery. Then we started understanding thermal surgery. Then we started understanding infrared surgery. So surgery is still the same, but we are using more technology, so the science is growing. Right? So in terms of Ayurveda, where are we? Same Patrapinda Sweda. Where is the technology that you have to use an equipment which can help you in Patrapinda Sweda in a better way? And where is the work which we have to do to understand that what is the effect of Patrapinda Sweda first, and after that, where is the effect of the advanced level of Patrapinda Sweda? And now what is the effect of Dhanurasana based on angle, based on mindset, based on endorphins, based on serotonin, based on melatonin? What is there. And then question is what is lacking. And when we find that what is the effect and what is lacking, and that point of time, we start integrating. So a very straightforward answer to your question is integration is a must. But at what level we are going to integrate the science, that is always going to be a question, because till you don't have basic technology integration not done initially, you don't know that you are integrating the other science into the right time, or you should integrate it at the later stage. You don't know. It is all about assumption based one way sometimes. One person says something and 10 people follow the same, and then so integration is a must. It is required, but in what condition and in what stage, that is a bigger question.
Thank you, Dr. Satyam Tripathi. Thank you so much for enlightening, and maybe if you have a time, last one question I would like to ask. What are the opportunities in Singapore and other countries for the yoga therapist, and what you feel the research area in addition to yoga therapists? If you can able to share your personal experience, because you are now settled there since a long time. No?
There's a lot of scope, honestly speaking, and the entire things are really having landslide movement. People are getting more and more aware, and when we say more and more aware, earlier 100 people were knowing about yoga, and these 100 people needed 10 teachers, right? So there was a need of 10 teachers in the past. Now that number of 100 who were knowing about yoga became 1 lakh. So when there is a drastic awareness, which means there is a drastic need, demand and supply, right? The simple economics, correct or not? So the supply is too less, demand is so high. So what is happening is 1 hour of yoga teacher, if he's getting paid if Indian currency 5,000 rupees also, there are no yoga teachers for that. They say that in 5,000 we are not going to do, because we have the offer of 8,000 somewhere else. So demand is extremely high, supply is extremely low, and a lot of borders are being closed. So options of getting few supplies are also less. So my answer is this wing has very vast progress, and definitely for next 15 years. For next 15 years, there is no slowing down. After that, we don't know.
Okay, thank you. Maybe this will motivate, take a lot of people in this career in the field of yoga therapy and even yoga therapy consultation, research. Dr. Satyam Tripathi, I was a little away because our Vice Chancellor has been called. So he's one of my batchmate, so did a lot of activities, moved there and settled there and doing a lot of good work. Even I think he has some branches in Hong Kong and other part of world, some branches doing wonderful. I thank you, Satyam. In a short notice, you can able to make these things happen. I thank you. I now over to Dr. Noza.
Thank you. Thank you.
Thank you, sir. The speech was so knowledgeable and engaging. You proved that you are an inspiring speaker with a well-informative and well-organized plan. Thank you very much. This comes to an end today. Tomorrow, let's meet again at 2 p.m. There are star speech makers to enlighten us tomorrow. Dr. K.S. Gopinath, a renowned oncosurgeon and Padma Shri awardee. He published many research papers in the field of yoga and cancer. Another prominent speaker, Dr. Suhas Kumar Shetty, Principal, BMK Ayurveda Mahavidyalaya, Belgavi College. He is an expertise in the field of mental health and rehabilitation. The speaker session will be followed by valedictory function. Dr. Nagaratna will be joining us for valedictory function tomorrow as a chief guest. Thank you all for joining us. Let us end today's session with Shanti Mantra.
Sarve santu niramaya, sarve bhadrani pasyantu, ma kashyet dukha bhavare. Om Shanti Shanti Shanti.
Thank you all.